Special board meeting of the North Broward Hospital District. We have a roll call, please.
Yes, Chairman Klein,
Present.
Commissioner Euring,
Here.
Commissioner Wellens,
Here.
Commissioner Gregoire, Commissioner Berry.
Here. Thank you very much, Patricia. Let's do the Pledge of Allegiance, Commissioner Wellens. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this point, we'll take any public comments. Are there any public comments?
Yes, there are. Mr. James Lupino would like to speak for Kershaw, Lupino, and Gable.
Thank you. Good morning.
Good morning. Good morning, Commissioners. Good morning. My name is James Lupino. I am an attorney. I represent Beverly Capasso, the CEO. She has authorized me today to make a proposal to you which may make the rest of this meeting easier and allow you to spend time on more substantive issues. Please understand that this is not to be offered as a renegotiation of her contract. It is not. As background, Ms. Capasso did not seek either the interim CEO position she took in May of 2017, nor the permanent CEO role that she took in 2018. In both instances, the Board of Commissioners reached out to her. Clearly, the performance of Ms. Capasso and the other members of the new executive team recruited during her interim capacity and her extensive prior successes as leaders of large, complex public health organizations factored into this board's decision to ask her to stay on as permanent CEO. There's no doubt that the result of the first impressive year and the fact that Broward Health did not find a more suitable candidate for the position from outside searches, that you asked Beverly to stay on until the cloud of the corporate integrity agreement of 2015 was lifted. And I understand that most of you were not involved when that came into play. When she agreed to take the CEO position, representatives of Broward Health, including General Counsel, the Human Resources Department, and a designee from the board, prepared and presented her with a contract. To the best of her recollection, she did not propose any changes to that contract except proposing to reduce the offered salary of $852,000 to $750,000 as base pay. It has been widely reported my client's total compensation package, including the 50% in at-risk incentive bonuses, is below that of her two closest public health counterparts, Carlos Magoya, the CEO of Jackson, and Aurelio Fernandez, the CEO of Memorial. It is reported in the Miami Herald, and I have copies of that for all of you, that both of their compensation packages are higher than my client's total potential compensation. Today's special meeting agenda, I believe, includes a discussion of the separate potential 20% at-risk bonus, which Ms. Capasso is eligible to receive, related to the improvement of the district's compliance program under Article 4.1 of her contract. As you know, my client is also eligible for a potential 30% bonus as a participant in the management incentive program under Article 7.1 of that contract. So, to be clear, my client is not suggesting changing the total potential compensation package she was offered by Broward Health, but she would like to help the board quickly resolve some of what the commissioners may have seen as conflicts between the goals and the balanced scorecard proposed for the management incentive program and the goals to be used as Ms. Capasso, as CEO's individual potential bonus for the improvement of Broward Health's compliance program. If it pleases this commission, she would accept, and she would in fact encourage, that the portion of the at-risk pay contained in Section 4.1 of the contract adopt the same targets as in the incentive plan, as the measure for the compliance target, or to be replaced with an equal adjustment in the CEO's potential payout within the management incentive program. She would be comfortable being judged by the targets which were fully aligned with with the rest of management. This would better align the goals of the entire organization and eliminate any possibility that the CEO could be paid a bonus if the rest of the organization was not. In summary, my client is currently paid less than her two closest counterparts, both of whom are male. She does not desire to renegotiate her contract, but again, she would be willing to define the at-risk compensation bonus targets similar to the management incentive plan targets. This would be to better align the targets of the CEO position with those of the rest of the management team. As a former commissioner herself, she appreciates the hard work of this board, which provides great service to the citizens of Broward County without compensation, and she offers this solution in a helpful manner if it so pleases this commission. Thank you.
Thank you.
But, can I,
Well, I think that we,
can I ask you a question?
yeah, why don't we, Mr. Lupino, if you're available to ask some questions, to clarify?
To the extent that I can, yes.
Yes, so it would still remain 50%, but Ms. Capasso would be judged as everyone else is judged, not independently for the 20%?
On the same targets.
All right, thank you.
Can I ask a question?
Sure.
Yes.
What happens if the management incentive contract never gets adopted, it doesn't fall into place? How do we then evaluate Ms. Capasso's performance if there is no management incentive contract plan going forward?
Well, I think that's a question that I'm not prepared to answer at this time, Commissioner Owens. I believe that our contract does provide for that program as it is, and it was approved by this commission when her contract was entered into. So my understanding of her contract would be that she's entitled to that bonus under her plan as it is. What this board does with the overall plan for all management, I think, has to be considered.
How would you propose that we would evaluate her if there is no management incentive plan, so therefore there are no metrics to evaluate her on, and we're aligning her, both of her incentive compensation and her 20% bonus to a plan that may not exist, it may never exist,
Well,
in the time frame of her contract? Let's just, I'm thinking hypothetically here.
I understand. Hypothetically, I'm similarly assuming that you are going to enter into that program because that's what the desired plan is. So based upon that, my offer was presented with that in mind. If you don't proceed in that accordance, we'll live by the contract as it stands.
Okay.
So you're, first of all, you give us this article saying that
I did.
Miami Herald.
Yes, sir.
I don't care what the Miami Herald says.
I understand, just to show you the background.
In the IRO, it says that her compensation is $1.3.5 million in a report that we did internally. Her total compensation is $1.3 million. So you're telling me that Aurelio and Carlos are paid more than that?
I'm not telling you that, sir. I'm not telling you what the IRS.
You said that. You
I
said
know.
she's paid less than the two male counterparts. That's what you said, right?
I did say that, and
that
I
is
said that.
incorrect. It is incorrect. You can give us an article from the Miami Herald. First, I'm just offended that you're the one talking to us right now. Beverly, I've spoken to you every day. You could have done this conversation instead of him. I don't understand your need to be here, and I don't understand why you would give me an article from a newspaper saying that here is her salary. You have it. You've read the IRO, haven't you?
Yes, sir.
You've read the study that was done by Gallagher or whoever it was that did it, that said she had 1.3 million, right?
What my comment was, sir, was that it was reported that this was the compensation, and that's what I
You
stated.
tried to indicate that she was paid less than her two male counterparts. That is what you said,
I did say that.
and that is false.
I don't necessarily agree
I'm
with that,
telling you
sir.
it's false.
Okay.
So,
Well, why don't we clarify what exactly you had intended to say with regard to the compensation as compared to the individuals you're referring?
I think the focus is not what is compared to the other individuals, although I did make those comments, Mr. Berry. What my focus is that she's willing to offer this board a resolution to the questions that have been raised in prior meetings, and that's the focus of my comments.
so seeing that you're the one that's sitting here, so you do not believe that she should be evaluated on time and attendance?
I didn't say that.
Well, you said
I'm
just what
making-
this says, that time and attendance shouldn't be a factor in her evaluation.
I didn't say that. I said that she was willing to be evaluated on the same targets that was offered to all the
And there's
managers.
nothing in there about time and attendance, because those metrics are purely outcome metrics, which I support and I like, and I believe they should be in her compensation. But are you telling us that she should not have an annual review as a CEO, as an employee of the district?
I'm not telling you that.
No, I think. so
I was
what
trying to make an
understand-
offer that would simplify your process, not make it more complicated, sir.
Yeah, I think there's potential confusion as to what exactly the offer is that you're making, sir. So, there's two elements of the incentive plan in Ms. Capasso's contract, correct?
That's correct.
There's one incentive for effective improvement in the district's compliance plan, and a separate incentive tied to whatever management incentive plan is adopted for management overall.
That's correct.
Okay, so could you clarify the interrelationship between those two incentives as you're now presenting it?
As I'm now presenting it, the correlation between the two is that she's simply offering to use the targets for the management incentive plan as the targets for her compensation under 4.1.
Okay, so.
That's all I'm offering.
Okay, so assuming an incentive plan is adopted for the management, which I certainly envision, there would be measurements that are created, and obviously we're gonna have a workshop on that today, to develop that plan. So assuming that plan is put into place and there's 10 separate metrics, that plan would result in a potential 30% incentive bonus to Ms. Capasso and other senior management, correct?
That is correct.
Okay.
Well, no, I just asked that question. It would result in 50%.
No,
That's step two. So step number one is the 30%.
There are two separate
incentive
bonuses.
plan.
That's correct.
Now, how would the 20% compliance component factor into
There's still two bonuses as entitled to her by the contract, 4.1 and 7.1. We're just trying to give you a simple calculation for the metrics to apply them.
Okay,
All
so
right.
what if we-
If we adopt the 30% and we find that the management incentive plan metrics have been complied with, Ms. Capasso automatically gets the 30% and the 20%. unless we
I
have
believe under our contract, she's
separate
entitled
metrics
to
for her.
that.
So in other words, the 20% will be triggered by the performance under the management incentive plan
It would be calculated as such.
on a pro rata basis. So whatever percentage of the 30% might be earned under the management incentive plan, that same percentage would be earned under the 20%. So half of it was, so if 15, if there was a, we're
Let me try to
obviously
make it
talking
easier.
hypotheticals.
What I'm saying is that there's two plans. We can forego the compliance plan, and I want to be in with the regular, with the management incentive plan. That's what I'm saying.
So in other words, you would not be measured under a separate compliance.
Correct.
That's
I
correct.
want to be
Separate
with
from the
my,
management.
I don't want to be separate. I want to be, if my managers are all going to be on an incentive plan, then I will. If you decide otherwise, okay. But I'm saying that I want to be with my manager. I don't feel that I should be separate. Is if they don't receive one, I sure as heck do not want to receive one.
Are you suggesting that you'd be willing to forego the 20% and only align yourself with the 30% of the incentive management compensation plan?
That's not what I'm saying, no.
You just said you want to be, you just said you want to be aligned with your management team, and if they don't get a bonus, then you don't get a bonus. They might not get a bonus, but you still would be entitled to up to 20% for metrics that are not the same as them.
No.
No, I think that's the key here, is what you're suggesting is that we one plan. That would
Well,
cover both
I gave
management
in my presentation, I gave an alternative. Either under the 4.1 calculations, you use the same metrics as you would use for the 7.1 calculation, or you put it all together, but the total package is still capable of reaching the 50% of the two combined.
Okay, so in other words, there's a plan there's a management incentive plan, and that's to drive proper management behavior and results, right? Improve our quality, improve our finances, et cetera. Now, as the CEO, she would be under that plan, eligible for the same compensation as everyone else, but as the CEO, she has primary responsibility for all the results. So that extra 20% would be in reflection of the fact that she's the CEO, she's responsible for overall performance. So I think what I'm hearing is that Ms. Capasso is comfortable aligning herself with the same performance measures that applies to everyone else. But since the contract is in force, it's been adopted by this board, that percentage, that 20%, should be reflective of her role as CEO above and beyond what the other managers would get.
Yes, sir.
Let me just add a little bit. So I think it's important to note this is a little bit of an unusual situation in the sense that Ms. Capasso's employment is a contractual compliance element, at least as I understood it, from my perspective, was intended to reflect the fact that her contract was in part to provide some level of easing through and transition through the CIA to give the organization some stability. What I think is important to understand is that of the balanced scorecard, there are multiple metrics, one of which is compliance, okay? And the potential for the management incentive plan to not hit all of the targets or even the full 30% is there. But to the extent the compliance element shines, that would be a situation where Ms. Capasso would be rewarded under Article 4.1 using the same metrics is what I believe I'm hearing you say.
I think that's a correct statement.
Okay. And, you know, I'm not particularly concerned, at least myself, with, as long as the compensation isn't outrageously different than her counterparts. You know, ultimately, from me, I was supportive of her being in this role through the end of the CIA. I felt that that would give us the time to then find that permanent person, whomever that is, okay? And the black clouds that are unfortunately still circling, hopefully will have lifted by then and we'll be able to attract the right person at that point in time. So, you know, I think it's important for everyone to understand that this is a little bit different than that permanent CEO role. And if we're going to bring somebody in on a contract basis where there's a CIA and the element of running through the term of that CIA is a major factor in every way, including the duration of that contract, it only stands to reason that there's a compliance element of her incentive. I don't see that being particularly strange or odd. But what I'm hearing you say is that since there are not metrics in place or specifically stated in the contract, whatever this board puts in place as it relates to compliance in the balanced scorecard, those would be the metrics that would govern Article 4.1.
So let me ask
Am I-
a question of you, based on
Me,
your
personally?
understanding.
Okay.
I can do that, right?
Yeah, I didn't know if
Okay.
you were looking at that, that's what I said.
So we developed the management incentive scorecard, and compliance is one of the factors in the management incentive scorecard. And when we do our final evaluation, we do well on patient, we do well on this, we do well, but we do not do well on compliance. How does that affect the percentages that we could?
Well, I mean, I think it would be twofold. If there's no bonus in the management incentive compensation plan assigned to compliance because certain metrics weren't reached, the way I would take that would be, there would be no compliance bonus under 4.1. In addition, there would be something meaningfully less than 30% that would come out of the management incentive compensation plan. That would be the way I would
Okay.
understand it.
I'm saying I don't want 4.1. I'm saying I am willing to say, forget about 4.1. It will be in the management incentive because there is a compliance portion of it.
Correct, that's what I'm
Okay,
asking.
yes, yes.
Like, as I,
But the 4.1, what would otherwise be under 4.1 would not be triggered solely by the compliance component of the management plan, correct?
I'm sorry.
In other words, the incentive that would be otherwise be earned under section 4.1 of the contract would not be solely tied to whatever compliance component of the overall scorecard that's adopted. It would be subject to the entire performance under the entire performance
Yes.
scorecard
Yes.
plan.
Yes.
Right, so I think, just to clarify, so everyone understands, there's two different options here. I mean, one is to tie it only to compliance. I think that's what you were just asking about, Vice Chairman Uri. Second is to tie it to the overall performance plan. And what you're proposing, and I think what Bev, you're proposing, is that it be tied to the overall plan. In other words, everyone gets measured in
Yes.
management on the same measures,
thing.
and whatever performance is achieved, that translates into dollars, and there's a certain amount of dollars that get paid based on the performance under those measures. And as it currently stands, under one proposal, for example, compliance is 10% of the overall balance scorecard. So it is a factor in the overall management incentive plan that I envision us adopting. So that would be a component of it, but it wouldn't be a separate measure triggering separate dollars for the CEO compensation.
All right,
That's
so
correct.
Can I clarify something? I want to make it very clear. There is no management incentive plan in place. There is no balanced scorecard. What we have is metrics that I believe Alan is using to manage the business, which I think are excellent metrics for him to manage the business. We have not yet had a single discussion, meaningful discussion, on a management incentive plan balanced scorecard. So, we don't know what the
So
evaluation
if
will
it
be.
doesn't happen, it doesn't happen, sir.
Right, so if it doesn't happen, how do we evaluate you for your 20%?
There is no 20%, I'm saying I'm foregoing the.
I asked that question earlier and you guys said no.
No, what I said, not her, was that the 20%, if you do not develop it, I said that she's still entitled to it under the contract because you didn't come up with the management incentive plan. But I also said that I expect that you will. She has clarified for you that she wants to align herself with management. She's entitled to the bonuses. If there's no bonus given by the management calculations, she doesn't get a bonus.
Okay,
You were
so
saying
then
it's conditional, and Bev has clarified it's not conditional upon adoption of the management scorecard. That if whatever scorecard is adopted will apply to her equally.
Yes.
And
Okay.
if you don't decide, then, okay.
Okay, so I think I'm understanding, and I wanna clarify, because I think this could potentially wrap up this workshop.
That was the intention.
Okay, so if no management incentive compensation plan is ever put in place by this board, her maximum bonus would be 20% under Article 4.1. If a management incentive compensation plan is put in place, she will live under the same metrics in Article 7 point whatever, and her maximum bonus would be 30%.
No, I don't read it that way.
So there is still a maximum bonus of 50%.
Yes, sir.
That was the way I understood it before, and that I got confused with some of the other comments, so.
Thank you. Thank
But
you.
then,
All right, thank you.
then we come right back to, if we don't adopt the management incentive plan, then we must have separate scorecard for Ms. Capasso.
Correct.
Unfortunately.
No, well, I think, let me see if I understand this correctly. I think I get it. What I understand, Ms. Capasso saying is that she's willing to live and die essentially, in terms of bonus compensation based on whatever management plan is adopted for management, if any. And if none is adopted, then none is adopted. If one is adopted, then her compensation would be based on potentially 50% of her contract compensation, whereas everyone else under that plan would be subject to 30%.
And if none is adopted, she gets 0.
Yes,
Okay, then I
Right,
do
okay.
understand.
yes.
Okay.
Yes, thank you.
So it's just a different scale that you'd be operating under, but under the same metrics, the same performance, the same analysis, which I think greatly simplifies our job here as a board, and I think it's admirable that you want to put yourself in with the rest of your management colleagues, that whatever plan applies across the board. I think it's an appropriate way to handle this, particularly given that there were questions concerning how to structure an appropriate compliance program specific to just one person, without creating certain incentives.
Let's be
So
clear for a minute.
why don't we discuss this, why don't we, Commissioner Barry, why don't we go in order here, let's have some.
Okay, so first, I am offended by Mr. Lupino's insinuation that this board is not paying Beverly for her 2 male counterparts are being paid. That to me is a veiled threat that I don't appreciate and is inaccurate, which is the bottom line. I've been asking for a comparison between the South and the North District from the staff for months. I finally got one at 8 o'clock this morning, which Alan is incorrect. It shows that her potential bonus is only $112,000, $750 plus 112, compared to Aurelio. What you sent me this morning is incorrect. It says the bonus potential for Beverly is $112,000. in any scenario, forgetting whether we take Mr. Lupino's suggestion or Bev's suggestion, there was a potential, there is a potential for a $350,000 bonus, or $375,000, whatever half is of the salary, not $112,000. And if you add that up, it is higher than Aurelio. Aurelio can do $1,023,000, according to what you submitted to me this morning that you got off of the Gallagher report from them. I don't appreciate that that number was not accurate, and that Mr. Lupino would suggest that this board was paying a different factor because of the sex of the employee, versus they made $250 million at Memorial. Their tax rate's down to $7 million. They've been doing that. He's been in the job for 3 or 4 years. She's been for 18 months. Mind you, I don't have a problem with Bev. I think you guys are headed in the right direction. I have a big problem with this contract. I think this contract is poorly written and poorly executed.
And that's why I had an attorney here.
I get it. And the contract is not Bev's fault, contrary to everybody's belief. I went back and I read Nass, I read Sinai, I read all the way back, I think, to Trower. The content's the same. Whatever we used garbage once and we continue to use garbage. There are some significant changes in the 24-month leave, or severance versus 12 months. There are some significant, or 18 months, I'm sorry, instead of 12 months. There are significant changes. There's a significant benefit change that was done unbeknownst to the board of unlimited PTO versus a fixed amount of PTO. That's a benefits change that has a huge impact on the compensation. So to suggest that the board is doing something inappropriate because of what you suggested, Mr. Lupino, again, is offensive to me and inappropriate. And if you have some specific charges, please bring those forth so that we can investigate them and deal with it. Having that innuendo out there does nothing for anybody. Also, a 50% bonus is huge. I like the balanced scorecard where it's going. I think the compliance piece is weak. It says the 2 factors on there are to make sure you fill out forms correctly. You're gonna get a bonus, anybody, not just that, this is for the whole group. I'm not going to go along with a bonus for filling out forms correctly. The idea of getting out of the CIA is a major issue. Go to this contract. You look at the beginning of this term. I don't understand how we could enter into an agreement that says that her contract term is 3 years or the end of the CIA. I don't believe Bev would do this, but somebody could sabotage the CIA to get an extension of their contract, right? Why would we do something that's so critical to the organization? Why would we enter into an agreement that allows getting us into more trouble to extend somebody's benefits package? Why was that put in there? You go through this, there's a part in this contract, and I have it right here, of Bev's contract, where she has to do the things that the board, we direct her. The suggestion here is that there'll be no evaluation for time and attendance, right? Because that's not gonna be in the balanced scorecard. How do you measure Bev as an employee of the district if all you use is the balanced scorecard? I happen to think the balanced scorecard is a lot more important than those other issues, but you still need to measure the employee on some of the basic parts of being an employee of the district. Where is that gonna be?
I'm not saying that, that's not what I'm saying.
But where is it? Where is it in the
I
contract?
don't know, the contract's been executed for 5 months, Commissioner.
So
She still reports to the board. She still is reviewed by the board. I don't believe that.
So section
there's
5.1, section 5.1, Capasso's review and performance shall be conducted annually in accordance with the performance review criteria established by the district, as outlined by the Board of Commissioners. This is in her contract, 5.1, performance and evaluation. I asked for somebody to please bring me how senior level executives are measured. How is Gino measured? How is Alan measured? That should be measured the same way. In this piece, what we're referring to, what you're referring to in 5.1 of this contract, where is that gonna be measured? And how are we as a board gonna evaluate that? It's not fair to her in 6 months from now to do her evaluation and say, well, you took 5 days off more than we thought you should take, that was fine. Is that a material breach of the contract? Does that give us an out? I think it's unclear. I don't think that this is clear enough, or we sat down with her and said, and what my intent today in this special meeting was to sit down and go over what are those performance requirements outside of those 2, and then define those 2 a little bit better. We're not doing that here. We are basically saying you could get a $300,000 bonus for key issues, obviously, but where do we evaluate her? Capasso's annual evaluation shall be, 5.2, shall be performed by the Board of Commissioners at a time and manner determined by the Board of Commissioners, but not later than 60 days. Any failure by the Board of Commissioners to complete the annual evaluation in time prescribed will result in an automatic pay increase equal to the prevailing market rates. I don't see that in CEO contracts that I've seen. I don't see that type of language. Going back to 5.1, what are we doing? How are we measuring her there? Where is that?
Commissioner, I think you're putting your finger on a problem within this board. And as I said at last night's HR committee meeting, there are problems we're uncovering, there are problems we're fixing as we go along. This is a problem. I have not seen any process in place for evaluation of the board's direct reports. We have 4. 3 of them have been recently hired, so obviously those folks have been evaluated at the time of their hire within the last 8 or 9 months since I've been on the board. We have one person who's been here for several years. There was a contract that auto-renewed for that person. We didn't even know that contract auto-renewed. So clearly there's a breakdown in our procedures that need to be fixed. This board needs to be looking at the performance of our direct reports and by implication, the results of their direct reports in terms of levels of performance. To me, that's what the balanced scorecard is intended to do, is to provide some accountability to our employees to the performance that we want to see from them. To me, implicit as an attorney, implicit in every contract is an obligation of good faith, an obligation to perform according to the terms of your contract and to perform for your employer. So to me, to suggest that there's going to be some deviousness for the purpose of extending a contract, that would be fraud, that would be illegal. We would find that, we would uncover that, and that would be obviously an actionable item. So I don't think that's a realistic scenario. To me, each of the employees, particularly our direct reports, have an obligation to perform as we expect them to. I don't think this board has apparently in the past done a very good job of setting those expectations. And that's one of the things we need to do, is set those expectations. To me, I understand that the HR committee is charged with that responsibility to do annual reviews, to set those targets and to present those to the full board. So I would suggest that the HR committee take that up in a meeting to be scheduled very shortly to begin that process and lay out what's going to happen and when it's going to happen. Because this is clearly a gap in what's been happening in this board's oversight. So I think that's exactly right. To me, I think we're getting off topic though. I don't think we're going to solve every HR problem here today under the context of a special workshop to address metrics, compliance metrics under section 4.1 of the CEO's contract. So I'd rather get this back on track, see if we can have a constructive discussion concerning whether the offer that's been proposed makes sense. And let's get that discussion underway, see if we are able to resolve this question of whether it makes sense to consolidate the 2 performance measurements into one, essentially is how I would describe it.
I think, just sort of in fairness to having presided over HR, that's, with the exception of our general counsel, nobody's been here long enough to end up being reviewed, unfortunately. There is a framework for which those reviews are done, and Ms. Barrett went through it. I don't remember the exact date, but she went through it, during my term. I do believe.
When that, roughly when that was? Do you recall?
I don't know off the top of my head. I just don't. But the point I'm getting at though is yes, I agree, marrying the direct report review process with the balanced scorecard metrics or what have you, whatever ultimately is decided upon, and let's just presume that for this purpose that there will be something approved, but to the extent there's not, I think that the very discussion of the balanced scorecard would form, at least the basis for how people are thinking. But there is a review process that is in place, and there are suggestions that had come out of HR in particular as it related to, Ms. Barrett. But outside of Ms. Barrett, there hasn't been any, since I've been on the board, there hasn't been anybody here long enough to have been, reviewed in a permanent capacity. And I think that's unfortunate, but it's the reality.
I would suggest that looking at section 4.1, Ms. Capasso has a $7,000 salary and a 20% bonus up to 20% bonus for the effective improvement of the district's compliance program with each CIA, with the CIA for each reporting period. As the CEO of this district, given where we've been, what our history has been, the problems that we have, and the problems that we continue to have with compliance, as stated in the most recent RO report we just got, which we haven't fully talked about, haven't talked about it all. I think it would be imprudent for us as a board to remove that measuring metric on the CEO, and I don't care who the CEO is. If it's Ms. Capasso today and it's somebody else down the road, the CEO has the ultimate signing authority and responsibility for complying with compliance and the CIA. And separating those two, I think, is a big mistake. Whether or not we agree on a management incentive contract, whether or not we ever agree on eligibility, who's in, who's out, that's for another discussion. The 20% piece is in the contract that exists today, because the 30% management does not exist today, and there is no metrics for that. That piece of it, I think, is the way we should be evaluating the Chief Executive Officer of Broward Health. And given what we know today, based on the IRO's report and the continued failures on the compliance side that this organization has, we as a board have the ultimate authority and responsibility to make sure that this organization is adhering to the agreement we have with the Department of Justice and the CIA. So therefore, I would be very opposed to removing a separate measure that evaluates the CEO on an effective improvement of our compliance program.
I
Now-
agree. We have labored, since I've been on the board a very short time, with compliance and our lack of compliance. And the IRO report, which will be provided once it's properly redacted, will show how far we are from compliance with the CIA. And the person, I supported Ms. Capasso, I'm glad she's here, but we need to have someone ultimately responsible for compliance, and we're not there. And I think Ms. Capasso has to be that person. So I want metrics separate from those of the rest of the management team to judge Ms. Capasso. So I agree.
I fundamentally disagree, unfortunately, because I think that there are a number of people, everyone in this system is responsible for compliance. It's not one person, it's everyone. And we have 4 direct reports: a general counsel, a chief compliance and privacy officer, a chief internal auditor, and a CEO who are responsible directly to this board for their performance. And to me, compliance falls on chief compliance officer and general counsel as much as it falls on the CEO. And if we're going to be holding people responsible, we need to hold everyone responsible. And creating incentive for effective improvement in the compliance, I think is a great idea. But if everyone thinks it's such a great idea, it needs to be a factor in compensation across the board to those people who, I think, to me, have more direct responsibility for ensuring compliance. As far as the IRO report, I think it's garbage. So to me, that's not a factor in our considerations today.
I take
So
offense that the IRO report is garbage. That organization is duly responsible.
Listen,
They've been chosen.
Commissioner, I expressed my opinion, you expressed yours.
I think we have to be very careful when we're challenging.
I'm speaking, I have the floor.
All right,
Please.
I think we're going to be very careful when challenging the authority
But
of the IRO.
I have the authority to say what's in my opinion. And that's my opinion. Having done an initial review of that report, I don't think it's going to stand up to the light of day. We'll get to that point in due time. But, to me, there's a lot of questions and concerns regarding that report. I'll leave it at that for right now.
I do understand.
So I don't think that it's something that we can rely upon to say, well, this report came out, so that means there's a problem or a lack of a problem. To me, we need to act independently of that.
I do
When we
understand
signed
that
this contract was signed with that component in there. The contract went through the HR committee. It was approved by the HR committee. It was then presented to the full board. It was approved by the full board. That is the contract we're operating under. The question before us today is simply one of whether to modify the application of the terms of those contracts as has been proposed.
to me, that makes sense to do that. Obviously, there's differences of opinion, and I think we need to focus on that question. Does it make sense to consolidate the incentive payments under the CEO contract into one potential performance incentive plan, or to keep those separate? So perhaps what we need to do is vote on how to, whether to accept that proposal or not. And that, to me, is the question on the table.
Are you finished?
Yes.
I take exception to your characterization of the IRO report. This same characterization was done several years ago under the Grant administration, and it was investigated by the Inspector General, and the Inspector General found that the IRO is completely independent and does not misrepresent things. I do understand that there are certain errors or inconsistencies or misunderstandings in the report, and we'll be happy to address those later. But to castigate the entire IRO report as garbage, that just is not right. And the IRO report will show you how many deviations from the compliance guidelines have taken place in just the last year.
Yeah, and perhaps garbage was too strong a word, and I retract that. I should have indicated that there are serious concerns with regard to the content of that report. And as we have an opportunity to fully digest that report and determine whether it's accurate or inaccurate, I think we'll make a final determination. So I appreciate that.
I agree with that.
Thank you, Commissioner.
So again, to the IRO report, I've had conversations with Bev, Alan, and Gino, who all acknowledge there are parts of that report that they disagree with, but there are also parts of that report that they fully believe occurred and happened. So I appreciate that you retracted that. Getting to the heart of what Mr. Lupino had suggested, if we stay with the 20-30 split, it says CAPASA shall be eligible to receive a 20% bonus for the effective improvement of the district's compliance program in compliance with the CIA for each reporting period. How's that measured? How would that be measured if we left it the same? What's the definition of effective? I mean, there's two attorneys on there. So what's the definition of effective improvement?
That's what we're here to develop.
That's what I thought. Well, this is for compliance, just for compliance.
Correct.
So,
That was the subject of today's
Okay.
workshop.
so I think we should continue to discuss those, and if we get to a point, and this would be my suggestion, we get to a point where we can't define those clearly enough, that maybe then we consider Mr. Lupino's suggestion, and then we go to a different scenario where, as Bev is suggesting, I don't want to leave out the fact that section 5.1 of her contract, 5.2 of her contract, 6.1, 6.2, her requirement per the contract to submit an annual work plan for the district in the form of a budget. When's it due? What's it look like? I mean, there are things in here that have to be measured as well, right? They have to be measured. It also says that in her position, she will do all the duties set forth in law in the district charter. Can we extrapolate those out so she knows what those are? I mean, are we just assuming that she understands and that the district charter has there's certain requirements on it, there's certain requirements on us. And if y'all read it, you'd be surprised at how, I mean, I'm sure you have. There's a lot of things that this board's responsible for. There's a lot of things that Bev is responsible for. Are we not going to measure that?
We are gonna mention it.
And where? We're not gonna measure it in the 20%, and we're not gonna measure it in the 30%.
Why would we not measure it in the 20%?
Because that is specific, and have you, or Mr. Levine, if you wanna opine on that, the 20% is purely for the corporate integrity agreement. If we accept it.
Compliance program.
Compliance program, okay, compliance program. But the bylaws and the duties as set forth in the district charter, aren't there other things besides the compliance program in there that she's responsible for? Where would those fit?
In her annual review.
Okay, so where's the annual review? I've asked for the annual review. What is the format we use? I haven't gotten it yet. Do we not have one for the CEO? Do we not have a
We need to
format?
develop that also. Maybe
That's what
a
I thought we were here
separate
to do today too, was the basics. I thought we were here to determine that.
So, General Counsel, you've been here the longest. I mean, is there a program in place for annual reviews that the board has established?
To my knowledge, there is for the general counsel. I don't know about the CEO. Because as you know, that there were multiple CEOs. And so Dr. Osnati was reviewed. He had an annual review. His metrics were published, his scores were published. It was done in an open meeting, so there
Do
were
we have
metrics.
access to those?
You would have to ask HR. That's not anywhere in the general counsel.
I've been asking for a month. I understand Peter's been out. I've been asking for a month. Alan was kind enough to get me a couple of things when I voiced my frustration to him on Monday. I've asked for those because I think that we should be clear with Bev as to what that is, so that she knows, and it's not a surprise at the end of 12 months, here's what you're being evaluated on. These things are important, just as important as the compliance piece, just as important as the scorecard. Those things are all together how she's going to be evaluated. Whether you assign money to one versus the other isn't the issue. The issue is how are we evaluating her performance? And does she know how we're evaluating her performance? And I don't think she does, because I don't think we know how we're evaluating her performance. And I don't think it should be a mystery. My employees are they see the evaluations when they're hired. They get it with their KSAs, they get it with their job description, here's what your performance evaluation will be next year. We're looking at these 9 or 10 factors. We are a huge district.
To that point, at the end of Dr. Sonati's
Could you turn on her
evaluation,
microphone?
I understand that the board.
Point of order, Mr. Chairman, could she turn on her microphone, please?
That
Could you move closer to the microphone, please?
the board, at the end of his evaluation, also determined the metrics for his next year, as Commissioner Uri indicated they did with me. So on an annual basis, the board sets the metrics for the base.
Yeah, it really is important to note, there is definitely a framework, whether this board wants to adopt that framework as is or modify it in some way. That's obviously the will of this board. Since I have been here, there has not been a CEO evaluation. Dr. El-Sanati's evaluation occurred before I got on the board. I am aware that it occurred. So unfortunately, with all the turnover in this board, there isn't somebody who can directly speak to that. And I think unfortunately, with the turnover in the C-suite, there isn't somebody maybe that can effectively speak to that at this precise moment. But there is definitely a framework, because that was exactly what I had requested when Ms. Barrett's review came about. So.
Could we get a copy of that framework? Because I, for one, haven't seen it.
I would suggest.
Bev, have you seen it?
I haven't seen it.
I would
no.
ask that the chair of the HR committee obtain the prior information relative to performance evaluations and metrics, and place on the agenda for a future HR committee meeting, and then that matter be presented to the board for full consideration by the entire board. And clearly there's a gap here, there's some lack of institutional knowledge, and we need to correct that as soon as possible.
That's also part of the reason why I had suggested that this meeting and the next meeting, particularly the next meeting, did not take place when you have the executive vice president of HR on vacation for 3 weeks. We don't have any information. We can't ask him to produce the document. He's probably got it in his file if he's got the file from HR. Nobody here has seen it. Commissioner Berry's asked for it, hasn't obtained it. I certainly haven't seen it. I didn't even know that this gentleman was taking 3 weeks vacation. He never indicated it to me, and I got an email from a staff member saying that he's out. So having the executive vice president of HR not here and on vacation and not able to provide these documents is one of the reasons why I thought that this meeting, and particularly the next meeting on the balanced scorecard, made no sense to have without our HR director here. So I think,
You know, an HR committee meeting was scheduled yesterday, knowing he was on vacation.
correct, and those issues we had issues that we needed to bring to the table, not that I wanted to bring to the table, but they were brought to the table. We needed to deal with an Aetna healthcare issue. They asked me to bring an issue that dealt with a potential adjustment to market salaries. And the third item that we discussed was a policy that nobody on this board apparently knew about, because we weren't advised, that there was a change in the personal time off. And it was a significant financial payment made of somewhere in the neighborhood of $5 million that was spent to pay employees, some of which were direct reports to this board. Those were the reasons why we had an HR committee yesterday, and those issues need to be brought to the table, and they need to be dealt with. We don't have a lot of time when we've got 10,000 employees wondering if they're gonna have a health plan next year. That's why we had that meeting yesterday. But I specifically didn't deal with anything that would require the HR director there because he wasn't available. And this is the problem. We have a review that we need to prepare for. There is a document that's been used in the past. No one has seen it on this board because we're not getting enough information and we're not getting enough cooperation to get this stuff done. So I would suggest that somebody goes to HR, one of the staff members, and finds that document and let's get on with this meeting. And I do not think we should be doing the next meeting, because it makes no sense to do that without some direction from the HR
Commissioner
director.
Wellens, I just asked Melanie to present what she had. After your email this morning, Commissioner Berry, I asked Melanie for HR VP, so she is on the way over to bring what she has.
Yeah, and I share, Commissioner Wellens, your opinion on the next meeting. This particular meeting, though, at least the way I read it, the agenda was very specific to compliance metrics. I don't know that that's necessarily an HR director. I don't know that's necessary for Peter to be involved. I think we have our chief compliance officer here. Obviously, we have the rest of senior management, and ultimately, it's what this board, wants to measure in terms of compliance. So, I think we're getting off topic just in general, but I share your view on the next meeting. I didn't understand how we were going to accomplish the next meeting, or the next workshop without Peter here. Well,
I think
So at this point, we're an hour into this meeting. The topic of this meeting was the compliance measurement plan under section 4.2, 4.1 of the CEO's contract. We've barely scratched the surface on that. There's been some discussion with regard to potential merging of that incentive with the overall management incentive plan. The next meeting is a workshop as well. Workshops are exactly that. They're workshops to consider how to approach these things, to make headway in resolving them, not necessarily resolving them today. So at the beginning of the next meeting, we can discuss how to approach that and what progress can or cannot be made in terms of identifying a performance incentive plan for the management team of 300 people. So what I'd like to do at this point is get back to the discussion at hand. The question to me, once again, is whether the board feels it's appropriate to combine the measurements that will be used for the CEO's performance into one management incentive plan component consistent with whatever's adopted for the rest of the management team, whether to keep the measurement of the 20% incentive separate, and then talk about how to structure such an incentive plan.
As chairman, if I could just say, I think that's a great idea. I think we should call the question on whether or not we want to merge those two items or not. And if we choose to do it, we have one direction to go. If we choose not to do it, then we can get on to the building the metrics for how we want to evaluate Ms. Capasso based on her contract. So I'm willing, I'll raise a motion that we make a decision, that we take a vote on accepting or not accepting Ms. Capasso and her attorney's proposal.
The floor is open to motions.
Was that a motion?
That was a motion.
I second.
I think as a point of order, I'm not sure that motion had the requisite clarity.
I'll restate the motion. Would you like to make the motion, Commissioner Gregor? You want to make the motion?
I move that we separately consider section 4.1 of Ms. Capasso's contract and develop the metrics to evaluate Ms. Capasso under section 4.1 of the contract.
I second that.
Okay, motion's been made and seconded. Is there a discussion on the motion? Commissioner Yuri?
Well, I just, are we then proposing that there will be separate metrics, entirely separate metrics for Ms. Capasso as it relates to the implementation of an effective compliance program from management?
That's how I understand the motion. Commissioner Gregoire, is that the intent of the motion?
The contract itself contains two separate provisions. One of those provisions is for compliance. The other provision is for the management incentive plan. We're now being presented with the proposal that those two be conflated so that there's only one set of metrics that applies to everyone. That wasn't the intent of the contract, and I'm not sure that I think it's appropriate. I understand Commissioner Berry's concern that there are other areas of the contract that this Capasso needs to be evaluated on, but apparently that's a third document. So we need to develop the metrics for compliance. That's the biggest issue we have right now. We're violating the CIA, I mean, every chance we get, apparently. We need that in place. Then we can judge the rest of the management team, and we can judge the direct reports under different metrics with different documents and different guidelines. But I
Mayor, you still have the floor.
I'm not, again, I think my question isn't exactly what you answered. My question is.
I tend to
are we-
answer what I want, but go ahead, I'll try again.
My question is, are we going to have wholly separate metrics for measuring Ms. Capasso and the implementation of an effective compliance program from the rest of management? And I think it's important to understand that, or to remember, that the balanced scorecard / management incentive program that has been discussed, not implemented, I am aware, okay, includes a compliance component that's not an insignificant component of that program.
That's debatable. It's
Well, there's
weak
only-
right now.
There's 5 main categories.
And compliance is one section, but the measures within it are weak.
Well, I'm not talking about the measures, I'm talking about, I agree with you, we have to get metrics. But what I heard Ms. Capasso say was she would be fine living under whatever the metrics are of the management incentive compensation plan as it relates to compliance for Article 4.1.
Okay,
So
let me try.
before we go through the exercise of establishing metrics specifically and only as it relates to Ms. Capasso, I think it's important that we make a decision on whether or not we want to have a system-wide effective compliance program metric or metrics.
Okay, I
Do you
understand
understand?
now what you're saying. I think there may be a difference, we're operating in a vacuum because we haven't developed the metrics yet, but I think there may be a difference between the way Ms. Capasso's involvement in compliance is involved and other lower management team members' compliance obligations are involved. I see that so that if we do what Mr. Lupino suggests and we conflate these two, and then we have only one area of compliance, we've got to judge everybody under the same standards. I don't think that was the intent of the contract, and I don't think that's the best way to judge the person at the very top. What did President Truman say? The buck stops here.
So this,
Do you have to, Commissioner Barry, let me just ask, do you have the requisite clarity on what the motion is?
I'm not 100% sure of what the motion is. I was just trying to clarify as it relates to the concept of having wholly separate metrics. There may be some overlap.
Well, then I
Did I
understand,
get an answer?
maybe perhaps I can shed some light on it. I think that there's a question and there's a conditional question. The question on the table, as I see it, is to whether to have one plan or two as it relates to the CEO for her incentives. Either we have one incentive plan or two incentive plans. If we resolve that question in the nature of having separate plans, then we turn to the question of what that plan is, what the content of that separate incentive plan would be relative to the effective improvement of the compliance program at Broward Health. And then we can determine at that time whether the metrics under the management plan will be the same or different as they relate to the CEO or her separate plan under section 4.1. Does that make sense? The question on the table is really just the initial threshold question of one plan versus two.
just to note, we've been throwing out 30%, so I've been looking at it. There is no provision in this contract for a 30% bonus. There's a provision for management incentive compensation plan in section 7.1. It doesn't say 30%.
Just so you know.
What we're talking about is 30%. And that's my misunderstanding, and having looked at it, there's no provision for 30%. So if we give the management team 5% for this balanced scorecard, she would only get 5%. So the 30%, why do we have, is that set in stone? Was there a previous meeting?
From a different document.
But that hasn't been, that has not been voted on by the board. There is no 30%.
No, it
There is no
not.
plan. We
But
actually
there's no
voted.
30% goal that we have to build a plan behind.
No, we actually voted to eliminate all existing and non-existing plans at the last board meeting. And there was nothing, so that we were very specific to say any existing plan or past plan would no longer exist, so there is no management incentive plan. So the document, the metrics, and the values of what anybody would get paid is for us to determine if we choose to determine it.
So-
I think we need to go back to the original question is are we going to evaluate Ms. Capasso on item 4.1 separately from anything we may or may not do for management?
But understanding her offer is critical, so I took, when I heard Mr. Lupino's offer, to be 50%, because I assumed the 30% was set in stone. When in fact, if we took her offer, and we came back and said, we're only gonna offer the management team 20%, that's all she's gonna get.
Correct. Up to 20%, correct.
Well,
In total. Right.
I don't necessarily understand it the same way, and that's why I asked that clarification. There's a 20%, potential 20% bonus based on her salary under section 4.1. There's a separate provision for whatever the management incentive plan is that's adopted, she participates in that management incentive plan. To the extent we merge those two things together, that 20% amount still relates to Ms. Capasso. So even if we adopt 5% or 10% or 20% under the performance incentive plan,
She gets an
for a
additional
separate
20.
amount.
Is that's what you were proposing? Okay, so, just so you know, you guys have seen, I will just say, I'm offended by 50%. I just don't believe in it, I don't think it's right, and I think it's too far removed from the rank and file. And I believe that the people who make Broward Health what it is are the rank and file. They've been left out of some incentives, and you all know it too. You've all
Yep.
bragged about them, you all know it, they are the people that make this run. Just in my company, my employees are the ones that make me, I'm not the one that makes the company. That changes things a little bit. I do think I think it's important. There was a misunderstanding publicly about the 20% for the compliance. People believe that Beverly's bonus of 20% is for compliance. It's not. And I think we need to be clear, and I don't want to go on record. It is for the effective improvement. I don't necessarily have a problem with that if we know how to measure effective improvement. We haven't even gotten there yet. So I tend to lean towards Commissioner Wellens and that keeping it separate. But what I might even want to further add to the motion, because there's a motion now to add to it or to consider, is if and I just really don't like having to refer this to Mr. Lupino, but if Mr. Lupino's offer continued or was left on the table pending us trying to see if we can even measure it, that we accept or deny that at a later date. That we accept the offer or not, once we figure out if we even can do this. Because I don't know, I think I know how to get to the effective improvement, but Commissioner Klein already, to some degree, attacked, but then retracted his attack on the IRO. You can look at just IRO reports. We hire them, we pay them. I have faith and confidence in the IRO. Do I know if everything in there is exactly perfect? No, I don't, but what I read is concerning. We have to believe something, we have to trust something. I believe the Fed said, you will use this company after we agreed to it. Signed by Al Snoddy, who was the former CEO. He signed the contract, he's the one that engaged the corporation. So, I'm a little torn on knocking it out and pulling it over. My goal, to be quite frank with you, on the balanced scorecard is to make it really difficult. I'm sorry, staff, and you know that. I am gonna make it difficult. You're gonna have to stretch. It is not gonna be an easy goal. We're a public system, and we have a duty to the public to quit taxing, and quit doing some of the things we're doing. So I'm not concerned about doing that, because I think if we hit the goals that, in my head, and I'm only one, that we're gonna put there, she's gonna deserve every penny of it, because it ain't gonna be easy. So I just wanna say that I'm a little torn about it, because I don't wanna throw it out now until I know, I don't wanna throw it out yet, until I know how and if we can effectively measure it, in fairness too. The mistakes made underneath Bev by her staff, her direct reports, are on her. She's the head of the organization. She's gonna have to live and die with those results. But then again, you have a person in purchasing at Coral Springs who does something inappropriate. Yeah, that's her, but it's also on the CEO of that facility. So how do you do that? How do you measure what's the most impactful thing? Direct reports? Alan goes out and does something wrong? That's on Bev. Gina does? That's on Bev. Bev does? It's on Bev. I want to come up with something that is fair to everybody, and also get this notion out that she was gonna get a I was told before I was on this board that she was gonna get a $250,000 bonus for complying with the CIA. That's offensive on the surface, it's the law. You're not gonna, we're not giving anybody a bonus for following the law. Effective improvement, how do you measure it? That's all I'll say.
That we have in the past distinguished between merely complying, because we don't think that deserves a bonus either. We've always understood that means improving our performance.
Getting us closer to exiting the CIA.
Correct.
We're 2 years into a 5-year plan, and I think we're in year 1.
Yeah.
I don't believe that we've made the progress that we needed to make, yet based on some
And
of
the
the
IRO
things.
agrees also.
Yeah, we have to have some things outside of all of this that we also measure ourselves. The IRO report, to me, left a bunch of things open for us to further investigate. There are things that say, I'll leave this to the board, I'll leave this to the board. I wish there would have been a conclusion, but it's really not his scope. There are things we are gonna need to look at in some innuendo and some suggestions that we have to take a look at to be responsible. So for now, I think I'm gonna to lean with Welland's proposal, just to keep them separate until we figure out if we can do it and if we can do it fairly.
Actually, it was my lead proposal.
Was it yours? I'm sorry. I can't pronounce your last name, so that's why I keep saying Welland's.
We'll have lessons.
Okay.
Mr. Chairman, I think there's a question on the table, and I think we should take a vote and get on to the work that we need to do one way or the other.
Does anyone else wish to be heard on the motion? I'll speak to the motion. I think it makes sense to consolidate the two items. To me, there are questions concerning how to come up with a plan, and it makes sense to consolidate the performance of the CEO with the performance of everyone else under the management incentive plan. Some of the discussion that was just had seems to reinforce that notion, but at the same time says, well, she should be measured separately. There are other direct reports whose behavior may be reflective upon whether we have effective improvement in our compliance program, but yet you're saying, well, the CEO is ultimately the only one responsible for whether that happens. So to me, I think everyone should be under the same plan rather than separate plans. But the motion's been made and seconded. Is there any further discussion on the motion at this time?
One thing, I think Commissioner Berry suggested that we not vote right now to see if we can develop the parameters, the metrics, whatever you want to call them. Was that in the form of a motion, or?
Well, that would require a motion
How
to
would
table
that-
the pending motion.
Right,
There's
how
already
would
a
that
motion on the
work?
floor.
Right.
We have to vote on the motion.
I thought Commissioner Berry said that he wanted to put Ms. Capasso's lawyer's proposal aside to come back and revisit if in fact we got down the road where we felt we had a effective measurement that would tie the CEO in with all the employees. And I think that's a separate decision, and that would be up to Ms. Capasso and her lawyer if they wanted to leave
Correct,
that
we
item.
don't know
out.
if
If they would do it, but I think the motion to keep them at this point separately and
That's
attempt to
the motion.
promote it is what Commissioner Gregoire had raised.
That's the motion on the floor.
That is the motion on the floor. Is there any further discussion on the motion? If not, we'll call the motion in question. All those in favor, please say aye.
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 All those opposed, nay. Motion carries 3-2, correct?
Correct.
All right, so the motion's been passed. So the board has decided to continue the plan separate at this point, and now we'll turn to a discussion of what the components of a section 4.1 plan would look like.
I would like some clarification. When I asked for the workshop, I believe I asked for a workshop relating to Beverly's performance evaluation, not just section 4.1. Do you have those notes? I don't believe I referenced specifically 4.1. I anticipated that we would make sure she had some clarity on Article 5, Article 6. We had some clarity for her on Article 4.1. And then the other metric that she'll get a bonus as whatever they said, that's kind of a no-brainer in my opinion. Whatever we measure them on, she's the one that's gonna implement it, so we need to put that in there. So why are we focusing just on 4.1 is my question.
That is what the agenda indicates. The agenda that was issued for today states, discuss and create metrics for the annual review of the president/CEO relative to effective improvement of the North Broward Hospital District's compliance program.
Does that limit us to
So-
4.1?
So it limits us to discussion of effective improvement of the hospital district's compliance program for today's purposes.
Is that what it limits it to?
If that's what it's in the
Okay.
public notice.
Okay, so then let's talk about 4.1. The effective improvement, there are 9 or 10 items on the compliance in the CIA, are there not? 9 or 10, 9? Do we have those? Do we have those? Anybody know them? The 9 items? No, yes?
Yeah, I think, Carterfield is coming up.
I think there's more than 9 items, but,
Categories.
There are 9 categories, I think. Yeah.
I have a corporate integrity agreement with me
Okay,
here.
so what are the 9, did you just have the titles of the 9 for now?
So the requirements under the CIA is, and I didn't bring a copy of the spreadsheet I created. We have, obviously the establishment of a compliance officer is number 1. And then underneath that is developing and implementing policies and procedures and practices designed to ensure compliance, making periodic reports to the board, at least quarterly, and monitoring day-to-day compliance activities, the establishment of a compliance committee, not to be confused with the board compliance committee, that's the internal, like what we call the executive compliance work group, made up of senior management that meets again at least quarterly.
Is that all number 1 so far?
That's 1 and 2.
Okay.
Yeah, number 3 is the Board of Commissioners compliance obligations. That's meeting at least quarterly to review and oversee North Broward's compliance program. And again, I'm skipping a lot of stuff in here. So this is just, I'm just hitting the key points within each section, so I don't want to come off as this is all encompassing every requirement under the CIA. Submitting to the board the OIG description of documents, other materials it reviewed. We do that within our annual report each year when, as part of the certification that the board completes. We also submit the backup documentation what the board rely on to make that certification. Number 4 is management certification, so that's certifying employees doing their annual certifications. It gets submitted as part of the annual report each year. And then that list, like I said, there is probably about 20 to 30 employees that fall within the certifying employee definition. That includes myself, Bev, Alan, Gino, Lynn, and other senior managers. Within number 4, you have under management certifications, it goes into subsection D, which is written standards. So we have to have a code of conduct, which stresses our commitment to full compliance with all federal healthcare program requirements. The requirement that all covered persons shall be expected to comply with all federal healthcare program requirements and our policies and procedures. The expectation and requirement that covered persons shall be expected to report to the compliance officer or other appropriate individuals designated by North Broward suspected violations of any federal healthcare program requirements or violations of policies and procedures. And then the right of all individuals to use the disclosure program and MBHD's commitment to non-retaliation and to maintain as appropriate confidentiality and anonymity with respect to such disclosures. And then underneath that is then also the policies and procedures within creating policies and procedures regarding the operation of its compliance program, including the compliance program requirements outlined in the CIA and North Broward Hospital's compliance with federal healthcare program requirements, creating a training plan, training and education, board member training. At the time we executed it, all board members had to be, all existing board members had received 2 hours training, and then any new board member that has come on since then has received 2 hours of training. Certification, each individual is required to attend the training, certifies that they attended. Whoever's giving the training has to have the appropriate qualifications to give the training. We have to update our training plan annually, and any updates to the training plan, or well, we at least have to review it and then update it as accordingly if there's any updates that need to be done. If we update it, it has to be submitted to the OIG for their approval. Compliance with we had to have focus arrangement procedures. Granted, this is still all under number 4. Compliance with anti-kickback statute and Stark law, so we had to have focus arrangement procedures within 120 days, which requires us to create and maintain a centralized tracking system for all existing, new, or renewed focus arrangements, track remuneration to and from all parties, track service and activity logs to ensure that the parties to the focus arrangement are performing the services required, monitoring the use of lease space, medical supplies, etc., to ensure that such use is consistent with the terms of the applicable focus arrangement, establishing and implementing a written review and approval process for all focus arrangements, requiring the compliance officer to review the focus arrangements tracking system, internal review and approval process, and other focus arrangements procedures on at least an annual basis, implementing effective responses when suspected violations of the anti-kickback statute, Stark law are discovered. Then we have new or renewed focus arrangements. We have an obligation to ensure that each focus arrangement is set forth in writing and signed by North Broward. We have an obligation to include in the written agreement a requirement that each party to a focus arrangement who meets the definition of a co-person shall complete 1 hour of training, and additionally shall provide 1 hour of training regarding the anti-kickback statute, Stark law, and additionally Broward Health has to provide a copy of our each party to a focus arrangement with a copy of our code of conduct and our Stark law and anti-kickback statute policies and procedures. We have to include in each written agreement that's a focus arrangement a certification that neither party to the focus arrangement will violate the anti-kickback statute or Stark law with respect to the performance of the arrangement. Then we have review procedures, general description, which is an engagement of the IRO. We have to retain all records. It gives the obligations that the IRO shall perform an arrangement review. They have to do a validation review. North Broward is required to do a risk assessment annually. We had to establish a disclosure program that includes mechanisms to enable individuals to disclose to the compliance officer or some other person who is not in the disclosing individual's chain of command. Any identified issues or questions associated with Broward Health policies, conduct, practices, or procedures. The disclosure program has to emphasize non-retribution, non-retaliation policy, and shall include a mechanism for anonymous communications. Broward Health is required to, under the CIA, there's a definition of an eligible person. An eligible person is anyone who is currently excluded, barred, suspended, or otherwise ineligible to participate in the federal health care program, or in federal procurement or non-procurement programs, or has been convicted of a criminal offense that falls within the scope of 42 U.S.C. 1320A-7A, but has not yet been excluded, barred, suspended, or otherwise declared ineligible. We're required, so the screening requirements that Broward Health has under that section is that we have to screen all prospective covered persons against the HHS OIG exclusion list. And we also have to, prior to engaging their services, so as part of our contracting process now, anytime a contract goes through the system, contracts administration or procurement, whoever's initiating the contract does those screenings as required in our background screenings policy to ensure that anyone providing services under the agreement or any party to the agreement is not on the HHS OIG exclusion list before us entering into the agreement. And we also have to screen against the SAM database, which is by the Office of Personnel Management. That's who maintains it, and it's a list of being excluded from any other federal programs, not just necessarily healthcare programs, right? So people can be excluded from participating in contracts with the EPA or, SNAP for food stamps, stuff like that. So we screen for that as well, because our definition of ineligible persons doesn't just include federal healthcare programs. So someone that may have been excluded from SNAP could potentially still meet the ineligible persons definition, even though they weren't. That's not a federal healthcare program. So they screen all of that before, and then we screen on a month, and then we're required to screen on a regular basis, which we did. So, or we do. We have a contract that we do that. So we also have a requirement that if we have actual notice that a covered person has become an ineligible person, we have to remove such covered person from responsibility or involvement with North Broward Hospital District's business operations related to the federal healthcare programs and shall remove such covered persons from any position for which the covered person's compensation or items or services furnished, ordered, or prescribed by the covered person are paid in whole or part by a federal healthcare program. We have an obligation to notify the government, to notify the OIG of any government investigations or legal proceedings that we are aware of. We have to do that within 30 days after Broward Health becomes aware of it. We have an obligation to repay any overpayments that we identify. We have an obligation under federal law to do that, but we have an obligation under the CIA to report that to the OIG monitor within 30 days of determining that an overpayment existed. We also have an obligation to report a matter that a reasonable person would consider a probable violation of criminal, civil, or administrative laws applicable to any federal healthcare program. We have an obligation to report if we discover that we have employed or contracted with a covered person who meets the definition of an ineligible person. And we have an obligation to report if North Broward files a bankruptcy petition. And then there's several requirements under that for, depending on which type of reportable event it is, what information is required to be submitted to the OIG.
So based on your read of that, how much of that does Beverly control? Just roughly, just to guess, because some of it's under your control.
A lot of it's under my control, yeah, but
So
then
what does
some of
she
the other
control?
things like contracting, stuff like that would fall outside of compliance
Yeah.
control, right? There's other systems that are in place that compliance isn't over. But a lot of the reporting requirements, everything like that that's my responsibility, right?
The reporting part,
Right.
if an issue happens, if one of the things that you have to report happens,
Yeah.
that could be her responsibility, because one of her direct reports.
Absolutely, yeah.
So is there an easy way that you probably are more familiar with that than anybody else? Is there an easy way, or even if it's difficult, is there a way to evaluate Beverly on the effective improvement of the plan, of the CIA?
Of the program.
Of the program,
More
yes.
than the
Yeah.
CIA.
Yeah.
I mean, I think it's tough to measure that. I mean, I really do, because then when you start listing out things that are requirements anyway, right, that it makes it very difficult to put something to writing. I think some of the things like training, I think is a good example of how we can improve the compliance program, and improve, the effectiveness of the compliance program is getting out more and doing more than just what our training plan requires, right? And ensuring staff attend those trainings and be measured against attending those trainings. I think that would be something that would have control of, as those people report up through her and her staff, right? Ensuring that they get out and attend those trainings, but then would also fall to me to ensure that I have the appropriate training set up and the qualified staff to provide those trainings.
Do we get anything from the monitor on a yearly basis when we submit a report? Do we get anything back saying, he did good, beat it? I mean, do we get anything like that?
We have not yet.
Because we haven't done good. I'm
Well,
assuming-
I mean, so the first report, no, right? So we got feedback from her, right, of what she wanted to see us do in the second year. And then we reported on that in the second annual report, but she has not provided feedback to our second annual report. So, I mean, from my position, this is just me, my personal opinion, I'm taking no news as good news. But there has not been any type of feedback of like, we're out of year one, I'm closing out that year, or, year two.
You're not gonna get that from
Well,
the federal government,
I
I'm
know.
sorry.
So we're approaching the end of year 3 of
Correct.
the corporate integrity agreement.
Jesus.
And you're now the chief compliance officer. You were interim previously. When did you begin to be interim chief compliance officer?
Interim, it was November of 2016.
Okay, so almost 2 years ago. All right, so
Yeah,
you've been,
close.
so you've been working with this for a while.
Yes.
Okay.
Can I ask you a question on that? So, there was a number of things that you read through that, that you have to report this to the
Yep.
OIG, you gotta report this to the OIG and so on. What, do you, I would assume the answer is yes, but I'm gonna ask it anyway. Do you have the same, responsibility to report that to the board? Because for the duration of the CIA, you may recall, you will have a dotted line to the board as well as the traditional reporting to the CEO, right? And so that came out of a series of problems that we had in the past. So in terms of reporting concerns, issues, violations, compliance, if you will, my presumption would be you feel the same responsibility to report those issues to the board directly. So while I was a little taken back when I heard earlier that, and I may get the verbatim wrong, but my recollection was some insinuation that we're repeatedly violating the CIA every day, right? That was disturbing to me because I had not heard such a thing from you.
Right.
Is that your assessment, that we are just
Repeatedly violating the CIA? No, that's not my
Because
assessment.
I haven't heard you bring, I mean, there's been very few things that have come to the board, or to the compliance committee, or in any meeting that you and I may have had. And generally, those few things have all been the types of things that have been reportable events.
Correct.
We had to report them, and I think that in my conversations with Laura Ellis, not that she's happy to hear that we have reportable events, but she's happy to hear that we're reporting events, because that is part of an effective compliance program.
I agree.
Is reporting those events. It's not necessarily that you have no events.
Especially, and I think it was touched on in yesterday's HR committee by Alan, you know, about the vacations. People go on vacation, someone has to step in, and then you discover things, right? So I think in regards to the turnover that has occurred here at Broward Health, right? We have a lot of new leaders in new positions. So we're gonna have reportable events as those new leaders get into their areas and start reviewing their areas. We're gonna have, you know, we're seeing that, right? We're seeing an uptick in management coming to us with issues as they discover them, and now we investigate those issues to determine if they rise to the level of a reportable event.
Right, I think the point I'm getting to is really twofold. One, I was a little, I'm gonna assume you were surprised to hear the comment made that we're just repeatedly violating the CIA.
I don't think we're repeatedly violating.
I don't either, so I appreciate you clarifying that. But the second thing is, I think it's really, really important to understand a effective compliance program doesn't mean that we don't have any issues. Okay? In fact, I would argue that an
It's
effective
the opposite.
compliance program means that we are identifying issues
And we're addressing them.
addressing them and taking corrective action. So
I would agree.
I think that makes the job that much more difficult to assign those metrics.
Right.
I mean, unless I'm missing something, which is entirely possible, but, you know, hopefully we can come up with some framework, but,
Yeah, and I would never want
I could tell you, I've had
no issues
multiple,
is good.
I was gonna say, I have had multiple conversations with Laura. I've met with Laura, 2 separate occasions, face to face. There's lots of room for improvement. There's no two ways about it.
Yeah, absolutely.
But I think in terms of putting an effective program in place, I think we are light years ahead of where we were just even a year and a half ago.
I agree.
Well, let me respond to that, because I think that was aimed at the remark that I made. I was basing that on the most recent IRO report, and I think Nick is doing an outstanding job, and I didn't mean to imply that I tend to speak in hyperbole. This IRO report is very bad to the extent it's inaccurate. I'm willing to listen to the inaccuracies, but this isn't good news. It's not gonna please the monitor, and I'm sure it's gonna get to the Inspector General, and it won't please the Inspector General. That was my point.
Nick, can I ask you a question?
Sure.
So, because I've never had a conversation with Laura Ellis. I've been on this board second longest to Mr. Uri, but I've never had a conversation, I've never met her, never talked to her. What value, if you were to score a value, what value would Laura Ellis place on Broward Health following stated written policies regarding contracting for services, the process, the documentation, putting it onto the system and following it. Is this an area of concern?
I don't necessarily think she would assign a specific value. I think she would say all requirements within our corporate integrity agreement are of equal importance.
Do you believe that that is a challenge that we continue to have, is following the policies that we have in place regarding contracting for services and vendors and things like that?
I think it's gotten a lot better,
Right?
but I think there are still challenges out there.
Is there a way to measure that? I don't mean quantitatively, but can we measure from year to year how much better we're doing in terms of having all of our lines of business follow the procedures that we have in place?
I'm trying to think how we would measure that. I mean, right now, the way that we're identifying issues like that is with some of the safeguards we put in place for payment, right? To where we can't, Broward Health will not make payment to a vendor without an executed contract in the system. And that's how we've been identifying those issues as they've come up. And it's become fewer and fewer and fewer as time goes on. I'm not saying those still don't exist out there today, but it is becoming fewer and fewer as time goes on.
And Nick, a quick question, more specifically on focus arrangements, which is really the centerpiece of the CIA, right?
Correct.
So from a focus arrangement perspective, we obviously have issues that we had, but from a focus arrangement perspective, it's gotten significantly better from when I got here.
Oh,
Would you,
absolutely, but I think we still have some, issues here and there, but I think it's gotten significantly better.
So we have
With
two
focus
types
arrangements.
of contracts, right? I mean, if we just high level it, focus and non-focus.
Correct.
And
Very high level.
let me clarify, I meant to say focus arrangements, I didn't say that, but I'm talking about focus arrangements, because that would really be.
I think focus arrangements has improved dramatically.
So, to me, I have concerns about both. Obviously, the focus arrangements are a higher level of concern, because that
Correct.
is the focus of the CIA.
Right.
But at the same
And
time.
they generally implicate a whole host of federal laws other than just the CIA.
Correct.
Right.
So
Yeah.
certainly, that's top priority. Secondary priority is all our contracting with any vendor.
Sure.
And I think that perhaps that's an area for further refinement and improvement. So if we were to look at the first priority, which is the focus arrangements, where are we on that? I mean, have we complied with everything that's required of us under the CIA relative to focus arrangements in terms of procedures?
In terms of procedures?
Right, in terms of
Not
processes.
completely. So one of the areas of concerns that still remain is our contracting database. Right, so I think currently newer renewed contracts that are going through the system as of today, or really as of, and I plan on presenting our report to the compliance committee in August in regards to our review of the annual review that we're required to take of our focus arrangement procedures. But just a kind of a high level of what we found is from January forward, there is a big difference in how things are going,
And then
right?
what-
So from
Yeah,
August,
good.
so our review was just for this reporting period, right? August 31st, 2017, new and renewed from that date forward. Between August 31st and January, it's not a great review. But from January forward, there's been a lot of improvement within Compliance 360 in our contracting system. But
And
one of the concerns that still stands out there is that we still need to go back and get everything corrected that had occurred prior to January 1st. Not that everything didn't go through the reviews, but that everything's not in our system, right? So really one of the things, one of the big factors was our conversion, right? The transfer from MediTrack to Compliance 360 was a mess under our former director of procurement, right? So I mean, contracts got missed from being transferred over. All the information wasn't transferred in. When the data was transferred in, it transferred inaccurately, so it makes it difficult to identify contracts.
How many contracts is Broward Health a party to?
So I have actually looked at the
A
numbers.
couple thousand.
Since January,
Yeah.
we've processed over 1,700 contracts since January.
So in the last
Focused
7
and
months.
non-focused.
So in the less than 7 months, 1,700 contracts?
That I have gone through Compliance 360. Nick, why don't
Plus
you?
all the existing.
Well, it's important to know too, because the letter of the CIA relates more to new and renewed, but Ms. Ellis
Right.
gave her own personal direction, as I recall, which I'm supportive of, but her personal direction was that this organization go back. She didn't care whether they were new or renewed, she wanted all
Yes.
contracts to go
Yeah,
through.
which was
And-
done
and
last
we're talking years of contracts.
Anything existing.
Any
Right, so
single
whether it was-
whether they were still continuing to provide services or not, if there was a contract.
I think it was like they were continuing to still provide services, as I understood her directive, right? So any existing contracts as of
Well, I remember that
8/31,
being a question.
2015.
I do
Right.
remember that being a question 2 years ago.
So when we executed the CIA on August 31st, 2015, any existing contracts on that date, she wanted us to review, even though technically the CIA only applies to new or renewed.
Correct.
So I think that's an area where we could probably pretty easily look year to year at the percentage of contracts that have properly moved through the channel. Have we found, you know, areas or departments where there's a lack of focus on that, or there's been, you know, I think that's an area we can clearly look at.
And each year I will be providing a report.
Right, we can't measure it like
what our
revenue.
review is.
We're not gonna measure it like revenue, we're up 17% in this, you know, but we can look at the contracting process and say, is the organization moving as a whole and individually towards a goal of 100% compliance, right? 100% compliance would be an effective improvement in our compliance program, without a doubt.
Sure,
And we're
yes.
not there now, I mean,
No.
we got 5 of them, 5 or 6 of them that were in this most recent report. I'm sure there's others, and I'm not saying that they're all under the control of the CEO, but as an organization, I think we can look at the organization, are we getting there? So that's a
Yes.
measure that clearly aligns with the goals of our CIA and improving our compliance department.
And then our response to it when we discover that, you know, employees have gone outside our processes and procedures.
Right.
Right,
Our
which is what
response.
we've done, right, which is the HR component, which we've done, I think, you know, a lot better recently on, right? As we've identified issues, is taking action and correcting those issues.
Mr. Chairman, can I make a statement about this?
Sure.
I think we're going down a dangerous road, and I feel the need to bring this up because during my interview with the IRO, they specifically asked me about this and told me that they emphatically agree with my thoughts on this. Scott in particular, and I think Nick, you agree with this too, I think it is incredibly dangerous. The board has a difficult task in trying to assign a level of success to improvement in the compliance program. I understand the importance of compliance. I think including compliance as a measure of at-risk payment is a difficult thing to do, but we're dealing with it now, right? The issue is that what you're trying to do, Commissioner Wallens, and what Commissioner Berry tried to do is make perfect sense. We're trying to make some type of objective measure of the success. The issue with doing that is all of the objective measures are going to require some type of numerator and denominator type review. The issue with that, and what I have an issue, the IRO has an issue with, Nick has an issue with, is that the essence of doing that creates a aversion or potential incentive-based aversion to reporting things. And so the only two options I see if we really have to be subjective about it is to either have a consultant that's procured through somebody, the board or someone else, that's completely independent from a compliance standpoint, that comes in and evaluates each year, how is our program now, how is it next year? That's one method. And the second method, which I also don't love, but that's why, you know, Commissioner Barrett, you brought it up earlier, why are we measuring people and doing something that seems so simple, which is additional training hours and additional and reporting on time? It's because that's really the only thing that we can really come up with that wouldn't.
Yeah, I mean, I do have concerns in regards to metrics, but I think you can see it from trends, right? Like I would never want to put in a metric that says, you know, 80% compliance is acceptable, right? Or 95% of meeting this requirement is acceptable.
So why are we doing this? I mean, we are being monitored by the feds. I was a monitor for the state. I know how it works. I gave feedback when they asked. Why don't we just ask her? Why don't we ask her after we submit the report that says, have we effectively improved the program? There's no way she's not giving us feedback. She's giving us.
She is giving us feedback. I mean,
She has to.
I think Nick, I think, is saying she hasn't given us formal feedback. And she didn't for the second year. In the first year, she gave us a lot of feedback.
Oh, yes,
She wanted
she was
to
down here,
see
we met for
measurable
hours.
feedback. And
Yes.
Commissioner Yuri, I think you know too, because you were here, she doesn't want holdovers, the employment agreements, the improvement in commercial reasonableness, they were defined and specific
Yes.
issues that are still going on, that we're still, medical directorships, the need for it, there's a whole program under Kevin Fusco that was developed to evaluate medical directorships. So she does give specific feedback about what we haven't been doing well and what we have.
Yeah, but there has been no
Well, I think,
formal.
yeah,
And
I
there's
think-
no
Which is what
formal.
I was speaking to.
Well,
There's no
but
formal.
on that point, there's a unequivocal, severe deficiency that we started with. And I think that the lion's share of those easy to wrap your arms around, objective, it's black or white items, I think have been identified and in large part implemented or significantly improved. The point I think we're getting at is we're moving into that direction of they're not quite as objective, they're not quite as black and white, they aren't as easy to measure, wrap your arms around. And I think that's just the reality, and that's not a bad thing. I think the good news is we have done a lot, if not most or all of those
So what we're saying,
items.
and what Gino, you're saying is, it's nearly impossible to comply with section 4.1 of the contract because we can't develop the metrics?
I think you could accomplish it, but I don't think it's gonna be as robust as what we're going to. So for example, the balanced scorecard on the management side, it's very objective, it's very easy to calculate, it's very easy to figure out what the industry best practices. It's simple, in my opinion. This side is,
Not so much.
no, it's
No,
very
no,
nebulous.
I disagree completely, and I think that in the training that we've given to you, you can see DOJ and OIG guidance on how to measure an effective compliance program. And perhaps
So
it's
it's in
in,
the
of course you can, and then I think that the issue is, maybe it goes to compliance committee, using the tools, some of which we provided to you at board training. The DOJ and OIG have tools to say, here are all the things you can look at, the board can decide which of those are important or not, but to say you can't do it, the DOJ and OIG puts it responsibility on boards to measure and the effectiveness
But
of
is
a
that
compliance program.
compliance or effective improvement?
Well, that's your
Commissioner
decision,
Berry's-
well, you either improve or you don't. So you can measure an effective compliance program and you can use those tools to determine what you want for whether there's been an improvement or not. Because Commissioner Yuri's point, you went from, however you went, and maybe you slid, maybe you didn't. But
Right.
the compliance committee could take that up if
I
they
wanna
wanted to.
stress, I'm not saying that can't be done.
Okay.
I'm just saying that it's not as objective as it would have been 2+ years ago. There's a meaningful subjective element, even within using the DOJ and OIG guidelines. There's nothing wrong with that. I'm not saying that it's bad.
But I do think there are still areas within.
I don't disagree.
Well, that's, I think,
that we can-
fundamentally, that's where we get to, is
Yeah.
we started, at 0, and we may be at 80, but we still have the other 20 to go, I mean, if we were to.
Sure.
So, right, so we already have cleaned up huge messes, we still have more to fix.
Yes.
I think the challenge for the board right now is to identify those areas that still need improvement, that are within the responsibility of the CEO and her team, and then putting some measurements around those to get, to an effective criteria of a performance plan.
Right.
So I think first of all, we need to look at, and frankly, I think that also falls over to the performance incentive plan for all of management. I think there's more that can be done there than just, as I think Commissioner Berry said, filling out the forms on time and getting them in.
Yeah.
So there's still improvement that needs to happen. The question is, we need to identify what those areas are, who's responsible for them. And if it's you, then obviously it's not Bev's responsibility. If it's Bev's responsibility, then we say, okay, let's look at that. We look at where we are today, and how do we get to where we need to be tomorrow?
Right.
That to me is really the simple approach.
I mean,
I go back to ask, I go back there to say, if there's some metrics in there, there's something that says, here's how you measure an effective plan, that we basically write that up, send it to Laura, and say, did we do this? When she says yes, that's the measure, that's it. If you're not doing your job, and Bev is seeing it, Bev's gotta do your report to the board.
Sure.
She may not have direct line over you at this time, but she has a duty to report to the
Sure.
board, as you do,
Just
if
like
she's
all
doing
of us.
something,
Yep.
just as she does, just as Lynn does. I think the only person that matters in this is the federal monitor. Their view of whether we're effective or not is the only thing that really matters. Their view is whether we're gonna get another 3 years added to this, whether we're in year 1, 2, 3, or 4, or 5. That's their call. It's not ours. We don't get to decide, unfortunately. We can internally look at it. But anything we put is gonna be an arbitrary measure. If we say a reduction in complaints, Bev could go out and tell her stats, tell her CEOs, tap that down.
I would never recommend that.
Exactly. So it's hard we can't do that. I think the only thing we can do effectively is to say to the monitor, if we submit a report, we submit the report in October, right? Is that
It's due
November?
in November each year.
November. That's one thing. But if there are some measures that they put in and said, these are the measures that you board should look at, we should look at them, measure them, say, yes, we think so, send it to her and if she says, yes, you've done this, even if there's deficiencies in it, we're identifying them, we're fixing them.
Right.
If she says, yes, you've done this, then that triggers the bonus.
I think, Commissioner, I think that could be an element of what the board has to consider, but I think it would be, to me, making that the sole criterion would be outsourcing the evaluation, and I think there's no real effective communication between this board and the monitor. I mean, I've never spoken with her either, so I don't know that we have that line of communication to be able to get that feedback. Perhaps we can. And that could be an
I
element
can't
of-
imagine she would not be responsive to, if anyone wanted to speak with her on
Yeah,
this.
I think improved communication is always a positive, so, certainly I think that I'd be happy to have those conversations, and I think we'd welcome that feedback to the board as to how we're doing. So that could be absolutely an element, that the board considers saying, okay, the monitor has said, you guys are on track, you're doing better in year 3 than you did in year 2.
Right.
And in year 4, you're on track to do better than year 3. That's where we need to be. Hopefully it'll be that we're completely compliant, but if we're not, at least that there's substantial improvement, or in the terms of the contract effective improvement in our compliance program. That's essentially what we need to get to. So to me, that's one element, is how they feel we're doing, but part of the concern I have is that line of communication, that the information that's being transmitted to the monitor is not solely from us. It's coming from other people. And so if the board is reporting that information, we know it's being reported. If we're not, then we have no control over it. There's I won't go there, but there's that concern over what information is being transmitted or not transmitted, up the food chain and, to the monitor on an ongoing basis, rather than what's in the annual report. Because the annual report, this board signs off on.
Sure.
Right,
Well,
so we know what's in that report, and we're comfortable with that. Based on the annual report, that feedback would absolutely be helpful. So, circling back, I think one of the points that I think Gino might have been getting at was there's a risk, and I think is what you're talking about as well, Commissioner Berry, is there's a risk in putting in performance metrics that say 0 complaints, because then there's incentive to have
Absolutely.
no complaints reported,
Right.
which is certainly the opposite of what we want to have. We want to have complaints reported where they exist. So the point of the plan is to uncover those and to report those that need to be reported, not to have 0 reported unless that's truly as a result of a completely effective compliance program. So we focus on one, the effective compliance program, and at the end, that should result in 0 reportable events and complete compliance. So I'd like to bring the discussion back to elements we think that can be part of that compliance program where we need to see improvement and that fall within the responsibility of the CEO and all those who report to her.
I think it's our contracting system right now.
So the contracting
Is our biggest issue, because then that also dominoes into another requirement in regards to tracking remuneration.
So
Right, is
step number
ensuring
one
that
is,
what we're paying is accurate, because we're still seeing, on a smaller basis, but still seeing issues with, people providing services without a contract, or contracts expiring and continuing to provide services. Now, a lot of these are patient care issues within the hospital, stuff like that, but we're still not seeing the full improvement of the contracting process in regards to ensuring timely renewal of existing contracts.
So category one is-
Specifically focus arrangements. Focus arrangements is what I'm
so
talking about.
category one is the contracting process still needs improvement.
I believe so, yeah.
Okay, so that's one criteria upon which the CEO can be measured, is effective improvement in the contract monitoring process, the contracting process generally, and then within that, there are subcategories,
Yes.
right? So one category would be every focus arrangement is in compliance 360,
Correct.
correct?
Yeah.
Are we there today?
No, I don't believe so. I mean, and I don't know if we'll ever get to that point, because who knows what's sitting in someone's drawer in an office, but I think we're getting close to knowing for sure whether, because they're not gonna get paid. Right?
All right, so
Because
step
if
number 2
payment
is
goes-
insuring cars.
If it's not in the system, there won't be a
Remuneration
payment.
is step number 2 to the contracting part.
Correct, and that's in place, right?
That is
So,
very
so if there's a contract sitting in someone's desk somewhere, we'll know it when they go to try to pay it.
Okay, so can we have someone act as described here and put together what we think of the elements that we're agreeing upon that need to be further considered? Patricia, can you do that? All right, so category 1 that we think could be a part of an effective compliance program measurement is contracting. Within that, one element is all focus arrangements within Compliance 360.
Correct.
And then the question is within what time frame or what percent increase. So right now, we don't know how many focus arrangements we have.
We do based on what's in Compliance 360 and what was maintained in Meditrack previously.
Okay,
But I think,
the
but my
question
understanding is contracts administration is still going through and validating whether everything transferred over.
Can I just give a point? So what happens is, so the control that I put in place is, when we go to make payment, there has to be a contract, so they know that they have to make payment. So that's how we're finding all these focus arrangements that they're not in C360, because then the AP says there's no payment. They escalate it to me, and then we go through the process of getting them into C360. So eventually, Nick and I have talked over the next year and a half, they're all gonna boil up to the top, and we'll be able to get them into C360. That was, in my opinion, the only way that I could figure out to get it done, and also keep us within compliance for the CIA. So that's,
What responsibility do you have as an administrative team to get the right product? I mean, Compliance 360 has its weaknesses, as you know, and we've talked about. Garbage in, garbage out too, so it's not just the product. But is that the right product for this? This isn't small ball, this is major. If that product is not sufficient, we need to get one that is. Do you believe, Nick, that it's sufficient?
I do.
Yeah.
I mean, I really do. I think it is sufficient. I think it's more the users of the system that is causing the contracting issues. I don't think it's the system
Do you think it's
itself. Now, I know
intentional?
I'm probably not in the majority in that opinion, but that is my opinion.
Do you think it's an intentional misuse of the system, or do you think it's a lack of training or understanding of how to use the system?
I think it's a lack of training and understanding. I don't think it's an intentional misuse.
We
of the
can
system.
fix that.
And that's another area that should be included.
Yeah, we should fix that.
I mean, I think some of the outlying areas, you know, some of the sites have large difficulty for some reason in using computer programs.
What is the training for Compliance 360? Is it formal training over a
I
period of time?
have to ask contracts administration, they own that. So I know that they've done training on it and we've assisted, you know, in answering questions about the questions, right? Because some people have had, you know, questions about, well, what does this mean? What do I put here? We've done those trainings, we've pulled in all the people that have done that, we've done those. But how to use the system and go through and what documents need to be aware of, that really is a contracts administration.
and just as for you guys, for your information, when he had referenced January, and January is an important time, because that's when we revamped the entire process. When I took it over, there was there was 3 or maybe 5 people that were doing contracts, but we're not solely for contracts. I have, since I got here, hired a contracts department of 20 people, and I have a manager and a director that are over contracts. So all that training and everything that we're working on is because of kind of the resources and assets and the training that we put into it, and that's why we're getting the better results.
So how can we?
I mean, I think people are following I think the poor results from the previous time was just the mass confusion in regards to the transfer, right? I think when we went back and looked, and you'll see in the report, I think a lot of the steps were done in Meditrack, but just wasn't, again, kind of going to the transfer again. And then why I feel we're still not meeting the obligations of our contracting requirements under the CIA is that we found a lot of documents in Meditrack that weren't transferred over to Compliance 360 during the transfer.
But they have been now, or there's still Meditrack documents that?
There's still Meditrack documents. I mean, I know contracts administration, you know, started a project to go through stuff, but
Is the goal
at what stage
elimination?
where they're at, I'm not sure.
Is the goal eventual elimination of Meditrack and everything will be in C360?
Well, I would think so, yes. That we go to one contract. Yeah.
So let me ask you.
And I mean, we're not processing anything new or anything there's nothing new going into Meditrack. But it's
can
out
we
there for
set-
archival purposes.
So Alan, I mean, you're already making headway in this area, certainly. You report to Bev, so Bev, ultimately you're responsible for Alan's performance. What still needs to be done in that vein to get the contracting process where it needs to be?
Okay, so the first thing, and they're working 7 days a week, they're coming on the weekends, we need to get the Compliance 360 in the field, in Compliance 360 working. And the most important field is the effective date and the term date of the contract. So we need to start, Commissioner Barry said, is the system not working? Well, it's not working because we don't have it set up correctly. So we want to be able to send alerts out to the end users 6 months, 5 months, 4 months, 3 months, every month, basically, hey, your contract's expiring, we need you to start to get a renewal. We have, as I said, we processed 1,700 contracts, so we're processing 700 contracts, and we haven't had a chance on the conversion to get all the fields in. So we tried to bring in some help. They were not skilled enough to actually go through all the contracts and read it, so we've taken it on our own to have compliance. Our 3 chiefs of staff, Nick came in, me and Gino will come in, to come in on the weekends, Saturdays and Sundays, go through all the contracting terms and put all those terms in there so we can start to use the contracting.
Yeah, so I've been helping myself and my staff have been helping contracts administration.
So what's a reasonable deadline for completion of that, the field?
I mean, it really needs to be done by the end of August. I mean, we've been talking about
5
this
weeks.
for a while. Yeah, I mean, it really does, because we can't run accurate reports, right? So when the IRO does their transaction review, I can't run them an accurate report and say, here's all of our focus arrangements, right? Because what the type of agreement's wrong, right? So it could be a medical directorship and it says employment.
Right. When we submit our report at the end of the year, right, the board has to either certify or not certify that we have an effective compliance program in place. So we are making a qualitative assessment on the report that you are producing for the year, on whether or not we think we have an effective compliance program.
And all reports from the compliance committee, board meetings, this meeting,
So-
right, all that goes into that for you to make that
So
decision.
we can make a qualitative assessment, because we're forced to do it every single year, on whether or not we can certify. So we can
Correct.
certainly look year to year and find out, in 2017, we couldn't certify because of these issues.
Right.
If they still exist at the end of 2018, contracting, we can't certify because of contract, and we know we haven't improved. That's a measure we could look at, is what are the things that are keeping us from certifying each year, correct?
Correct. Yeah,
So
any
we
exceptions
can make
on your
qualitative assessment as a
certifications.
board of how well we think management has done in moving from point A to point B. I can't hold them accountable for something that happened 10 years ago, but if we've known about it for 2 or 3 years and we haven't fixed the problem, we can hold them accountable for that. I think that's a reasonable way to look at it.
Yep.
So I think there's a qualitative assessment that can be made. It may not necessarily be quantitative. Again, we're not looking at
Yeah.
revenue. We're looking at the overall, or can we certify, can we not? Why can't we certify? Is that a known problem? Has it been a persistent problem? So I think this board can make a reasonable judgment on that year to year. I think that's a factor in here, is can we certify? We should be able to certify every year. That should be the ultimate goal here, that we can certify the effective compliance. And until we get to that point, we don't have an effective compliance program.
I hope we do, because we
Well,
certified.
yes. I mean, I think it's, I think there's,
Qualifications.
saying meeting the requirements of the corporate integrity agreement and then having an effective compliance program.
I mean, well, but I think, I'm understanding your point, but I'll try to tweak it a touch. There's corrective action that we have to, obviously take. And so, to the extent there's, from the prior year, the corrective action that is identified and taken, that's one other somewhat objective, criteria. I don't know, I guess, for this board to certify that we have, and if you read the certification, it's crystal clear.
Yep.
Okay, for us to certify, I think it's awfully difficult if all of these other things that we're discussing haven't been effectively implemented.
Well, I think it will be difficult for you to certify that we're meeting the obligations of the corporate integrity agreement.
Right.
I think an effective compliance program is a little different.
That's what.
Right, like I think
That's
there's
what I'm-
nuances between them. And, you know, they can be one and the same, but I think there's some nuances between it, right? The effective compliance program to me goes more to when we identify issues, our responsiveness to those issues, addressing those issues, taking corrective action, disciplinary action.
And you
all of
also
those
have
things,
that
right?
tug of war that we discussed about a year ago of, you know, thwarting the reporting of things by measuring it and incentivizing for not reporting something, right? I mean, that was something that we discussed a year ago as being a concern over how we implement certain measures, incentive compensation. We want to encourage people to bring issues forward, right?
Correct.
If you don't encourage people to bring issues forward, or if you effectively discourage them to bring issues forward, because that potentially means some
Well,
metric.
it would only be
not
to the detriment of the district, right?
Exactly.
Because that just means problems will go on longer without discovery.
Right.
Which causes larger paybacks, fines, all of that, versus finding out about things earlier. And, you know, if there is an issue, we're stopping it quickly and fixing it.
Right.
Which
And-
limits
and
the
then-
liability of the district.
And also, I think it's safe to say, an effective compliance program identifies those things.
Correct.
Right.
So going back to Commissioner Klein, what are the 3-4 areas that we can measure? You talked about the contracting system. Somebody said something about remuneration. Timely submission is an issue. There needs to be something with the federal monitor. There needs to be some, if we all say, hey, everything's great, and the monitor says, you guys haven't made any progress, probably a qualifying event. The monitor has to say there's some progress for us to do anything. But then from there, if that's number one, the monitor gives us some feedback that we've effectively moved forward, or that we've moved forward, if she's not willing to say effectively. Then you look at these other issues, contracting, remuneration being accurate, certification would be key. If this board is not able to certify the report, we shouldn't be giving anybody a bonus. I don't think, I mean, I wasn't here the last time, I believe you all certified last year, right, but the year before?
With
we did.
exceptions. Both years have been with exceptions.
So I think you need to narrow it down to a couple areas like you were suggesting. And those are the ones that I've heard. So would it be, you know, Laura's feedback is one, and the ability to certify are two. If you can't do those two things, you don't go to step 3.
So so you're saying certified with no exceptions? So just a
I mean,
plain certification?
What were the exceptions?
No, I think that's what we're trying to get,
Yeah, so I'm
trying to avoid.
What were the exceptions?
Is,
I think
is
last
very
year was the
exceptions.
top of my head, I think it was still the contracting database, having everything in one place. And
Process thing, not a
It was.
violation. If it's a process issue like the database, I don't know, I mean, that's what we have to kind of figure out, what's really the kind of qualifier that's a knockout qualifier and what's not. I mean, I would think the contracts database at this point probably needs to be right. You know,
Well,
we've had enough time.
It affects a lot of things. There's a domino effect with it not being accurate.
But that was a requirement from the original CIA. I mean, so that's something that should have been done. Obviously, there were a lot of challenges.
And
the
then
system
we
was
switched
worse than-
databases, right? So Meditrack didn't meet the needs,
Yeah.
so we switched databases to Compliance
Is
360,
it-
and then there's been trouble with that transition.
Is it possible to certify without exceptions? Do you believe so?
Possible.
Do you believe so?
Yes.
So
You mean right now for this system?
Not right
or in
now
general?
today, but
In the future?
by November, do you think this board,
No.
could get to the point? Is it impossible this
Because you're certifying only up till the end of next month.
Okay.
Right, so
And
I'm
it's
not
probably
saying, I'm not
impossible
saying
for
some
us
of
to
these
do.
issues couldn't be resolved by the end of this year, but I'm just saying that you're only certifying up till the end of August.
Right, but there's also the element of effective improvement. If you've got 5 exceptions in 2017 and 2 exceptions in 2018, right, an effective improvement. Well, I guess it depends on what the exceptions are, probably. Correct. But I mean, is the goal, of course, to get to a clean certification with no exceptions, of course?
Yeah.
100%.
So why don't we, so,
5 items or something?
well, let's let's at least get some categories on the table so we know what we're discussing. So I think number one is, we've already put, rule number one is contracts as a broad item. Within contracts, I think we want to see completion of the fields for compliance 360 to be done within some period of time. We need to attach a time frame with that. I guess remuneration is probably a separate one. I had it kind of under contracts, but maybe topic number two, or numeral 2, is no payments to vendors without an effective contract, without the contract being entered into our compliance 360 system.
And that it's accurate, right? And I would say, well, the payment's accurate according to the terms of the contract as well. So just, I wouldn't want to frame it as just if they have an executed contract, we're fine to pay. That the payment should be consistent with the terms of the contract.
All right, so that category would be payments to vendors. And item 1 would be the contract has to be in compliance 360 for payment to be made.
Yep.
So no payments would be made without it being in compliance 360.
But then I was talking from like a tracking.
So number 1 is no payments without a contract being in compliance 360.
Right.
And then 2, that the payment would be issued consistent with the terms of the contract.
But isn't that a requirement, a policy that we have? I mean, we're not improving, I mean, that's a minimum standard, that every contract should be in there, and that no payment should be made without a contract, yet we find ourselves making payments because there's no contracts.
We're not making payments anymore.
Yeah, I haven't seen that recently, where we're making payments without a contract.
I can think of several of them in the IRO report where we got a demand letter for a payment.
No payment was made, no payment.
So we're not gonna pay them?
Not unless I have a settlement agreement through legal.
It doesn't erase the problem.
Doesn't erase the problem.
But the
Demand
payment
letter-
after
No
the payment
payment
though,
before
before we
services
stop
are
the payment,
provided.
we stop the payment. That's 2 separate issues. That's an employee going outside of the policy, and we would have to educate, train, and discipline that employee for doing that. The actual payment being made to a focus arrangement is not happening because we have check and balances in place to stop it. That's all we can do as senior management.
But then the second check to that is, we need to ensure the services are provided for the focus arrangements, which I think we still do see examples of that,
Right.
especially in the hospitals, to where we're having services provided and there is no contract.
Right.
So then we kind of get stuck at that point, right? Because people are providing services expecting payment, we have no contract.
Right, but we're
Or
at
the
least
contract
able
is
to-
expired.
We're able to mitigate it and at least document it and see the reason why we made a payment outside of the service. It's not right, and it needs to be improved, but we have strict policies and check and balances in place to ensure that we're not making payment. That's how we're finding all these issues.
Right, so that to me is a valid criteria, that the payment won't be issued. We're talking about focus arrangements, right?
That's all I'm speaking to right now. is
Well,
focus.
but I want to talk about
As
separate, I
under
want to talk about other
CRA.
contracts as well. Because we apparently have other contracts out there we're making payments to folks or vendors, and I don't know how those are being reviewed and categorized and tracked.
Right.
So, but let's, I think the focus arrangements obviously is our number 1 priority, as we said earlier. So, that to me is a valid category, that payment will not be made to focus arrangement vendors without a contract being in 360. Is there agreement that that's a valid criteria?
I think
I mean,
it's
that's
a
a staff,
requirement.
I think to Commissioner Wells' point, I think it's just a requirement.
It's a requirement.
Why are we rewarding for a requirement? We should be
We're not
rewarding.
any of a
So
requirement.
why are we rewarding compliance? Compliance is a requirement of the job. That's what I think we're trying, right, like, being compliant is a requirement of the job.
And you can measure effective compliance by using the DOJ.
So then stopping a payment for not being made to focus arrangement is an effective, a compliance that
In
we
and
have
of
something.
itself, it's something to give additional, everybody needs to do it. So what we're required, I think the issue was when Peter said he wanted to do rewarding for the CIA. And you said you can't do that because anything you're required to do shouldn't get additional incentive payment for anyone. So if you're required under the CIA to not make payment without a contract and you don't make payment before services are provided, that's required by the CIA. And it's not just a policy issue, it could be a start violation. So we just found one that's a start violation because there was no contract, it's a focus arrangement, so it will likely go into a reporting event.
And Nick, from our compliance program perspective, was it escalated to you, and did we have an effective compliance program to catch that stuff?
Yes, to catch it, yes.
So you see what,
Like I
having
said,
that happen is bad, right? I think that our job as senior management is to educate, train, and discipline. We are gonna handle that situation that happened from a disciplinary perspective. But we have, from our perspective, my job as senior management is to create a program that won't allow that to happen, which we did. Now, if that's not what you guys wanna measure from a compliance bonus, I'm okay, just tell me what you guys want us to do, and we'll do it. I just wanna do the right thing, I wanna be compliant, I don't wanna be in IO reports, I just wanna move this organization in the right direction. That's all we wanna do, so.
We're definitely moving in the right direction.
But,
Debating that.
I'm okay with when things get brought up and I'm happy about it, but it's good that I have people calling me and saying, hey, I have a compliance issue. And I feel that I'm doing my job effectively because they call me up and they know that I'm not gonna, go crazy on them and they're gonna lose their job and they're not gonna be an IO report because they missed something. That's what effective compliance is. That's the environment that you guys need to create and then we need to trickle down to the organization. And that's what we have done. You guys should come to the next compliance meeting and hear all the things that are being brought up in the compliance meeting, even though that they may be not compliant, but they feel comfortable enough to do it. That's compliance.
And there are other categories relative to training and ongoing education that I think can be a separate component as well. Because the management has, and in compliance, and GC obviously have an ongoing responsibility to educate and to train personnel, particularly as we continue to turn over a lot of personnel.
Yep.
So to me, the training, or at least the training and the dissemination of information component can be part of this, depending on whose responsibility it is. If it's your responsibility, Bev's not responsible for it. If it's her responsibility, it's not yours, so that we have to obviously delineate that. So to me, that would, that's a potential, fifth category. So let's, try to make some progress. It is 1 p.m. here. We're obviously into the time that we had allocated for the balanced scorecard. Is everyone comfortable proceeding with this discussion? To me, I think this helps illuminate the
Can I
discussion.
just add one more suggestion for the group?
Yes.
How about do a survey, that with questions, like questions from 300, like all the managers, that is totally, confidential, and have them ask questions, and based off of the survey results, you guys can make a decision if there's an effective compliance program. That's just suggestions to the group. If we're trying to get to the goal of having an effective compliance program, a survey, which we do an employee, in the balanced scorecard that we'll have, if the employee satisfaction, that may fall into a category. I don't know.
Well, and you're talking about compliance at a normal facility. You're not talking about compliance at Broward Health that's under a CIA. There are not a lot of hospitals that are under a CIA. Out of the 6,000 in the country, there's probably a handful of them that are. So there's a difference between a compliance program at a healthy organization that isn't under that. And you're exactly right. You're the cop. You catch it, you fix it. You catch it, you fix it. That's what you're supposed to do. This is bigger than just that. The risk of not complying with the CIA, with breaking that, is losing your ability to build federal funds. We lose the ability to build Medicaid, Medicare. All 8,000 people can go home because there is no organization. We can't tax the people enough to make up the difference between this and that. We cannot blow the CIA. It is a problem for us that is significant and big. It's not a simple compliance. I agree with you wholeheartedly. You're doing what you're supposed to do. You're catching it, you're moving. This is a little different. This is a significant burden we have on us that we haven't made progress in 2 years. Do I think there's progress now? Yes. I mean, according to that, if it was a 5-year plan, I think we're probably still in year 1, 1.5. We should be in year 3. You don't think we're in year, you can't think we're in year 3, right? We have some work to do. We have to catch up. I'm not blaming I'm not blaming anybody at this table. But before we even start where you were going, I would ask Patty if she would read out, because I know what I asked for, and this isn't the only thing I asked for, Patty or Lynn to read out the public announcement for this meeting. And it's different than the agenda. I don't know why, and I'm gonna figure it out, but can you please read it out? This is what was in the Sun Sentinel, I believe.
Sorry, I have to find it again.
while Patty's looking for that, I think that the topic of this workshop was developed back in March or April at a board meeting. There was an HR meeting and then there was a board meeting. And I believe it was Commissioner Wellens who said that the CO, is entitled to know what she's gonna be measured on. So we need to come up with the measurements surrounding what is an effective improvement in the compliance program. So we said, okay, we're gonna have 3 workshops. One is gonna be this one, and it was prioritized first for the reasons that was mentioned by Commissioner Wellens, and 2 was we need to come up with a balanced scorecard, and obviously that's a high priority as well. Since we ran out of time in June, there were some concerns or issues regarding commissioner availability, so the meetings weren't able to be held, so we ended up having both these workshops today. That's how these workshops came to be scheduled for one day. But that's really the genesis of how this workshop got scheduled was, we have a contract, we don't know what it means, let's put some meat on the bones so the CEO knows what she's gonna be measured against.
And that should include everything. And who handed this to me?
I did.
Okay.
I just want to make a note for the record. We didn't have, because we were in a rush, we don't have copies for the public, but after this meeting, we will get copies.
Okay, did you find it?
Yes.
Okay, can you please read it out?
The purpose of this special board meeting is to discuss and create metrics for the annual review of the president/CEO.
That's it. That's a lot more than just section 4.1. Now this, obviously some of it was just created, but it's how do you effectively measure the CEO? It's a job description, it's for her, it's for the general counsel, it's for the chief compliance officer, it's missing somebody. It's got the performance appraisals toolkit. It's got what actions, performance appraisal process for direct reports to the board. So that's, pretty clear. It says, obviously it needs to be massaged by the board, and I'm sorry that you all have it. It has the KSAs, or the job description, the position summary. It has what the values are: exceptional service, collaborating with their team, accountability for positive outcomes. I mean, and then for general counsel, and then for the compliance officer. But there are some things here that Bev should know about, and the board should know about, that are basic to her job. Forget the bonus structure for a second. These are her basic responsibilities for her job. And I mean, this is what we should be working from, in my opinion. So what I would suggest, if you were about to take a break, let's take a break, get copies of this for everybody, and let's talk about it in conjunction. Let's finish the conversation on the compliance part, but let's at least talk about this so we know we're looking. We probably won't be able to deal with it today, but let's talk about it.
But if we keep adding things to the table, we're never gonna complete what's on the table. So my concern is that this workshop is scheduled specifically for section 4.1, to meat on the bones. That is what it was scheduled for.
I recommended the workshop at the HR committee that I wasn't a member of. I did because I felt that it wasn't fair to have a nebulous kind of deal. The contract is not written that well, if you ask me. It doesn't really say what effective compliance is. If I were the CEO signing this contract with the district, I would have asked for some definition around that, because it leaves too much to chance. What does it really mean to do that? So when I suggested it at the HR meeting, I think you can find the notes for that HR meeting, I talked about it as a global, let's just get this done. Let's put this behind us. Let's evaluate what this is. I've asked Beverly about it, and she said to me the first time we met, I told her, I don't like this contract. But I also told her that I read Frank Nass, and I read everybody else, and it was basically the same. That doesn't mean the organization has to continue to use a faulty tool. So we shouldn't be using a faulty tool. And there's provisions in this contract that we can use to not do that. I don't want to do that. What I want to do is figure out how we put to bed for once and for all how Beverly's going to be evaluated end to end. Everything in the contract, so that she knows, we know, and we just get it done. It's not going to be that hard. This is not bad. It's not uncommon. It's not very hard for her to achieve these pieces. What's going to be harder for her is the corporate integrity agreement, and then whatever we do on the metrics. So I understand putting more things on the table, but the intent from me proposing it at the HR meeting, Commissioner Uri and Wellens, you were there when you two were debating what to do, how to handle it. My solution, what I interjected, was that we have a workshop on all of it, not just about section 4.1. I mean, there's too many significant parts here. If we're stuck with 4.1, then we're gonna have to do another one of these to deal with the rest of it. I wanna get this done and passed. I would imagine you do, Bev, to get this done and over with so we can just move on about doing the business of the district.
Well, we absolutely have to do that review. I mean, there's no doubt, you know, that the reviews of our direct reports have to be done, there have to be some criteria developed, and there has to be a process in place to conduct those reviews. I mean, I don't think anyone disagrees with that. Those, to me, go to whether you hire or fire the person, whether you retain or fire a certain person, whether they're performing or not, because they don't go to compensation. Compensation is contractually set at this point. The element of compensation that's contractually set but not defined is effective improvement in the compliance program. So that is one of the gaps right now that we're trying to fill. That is kind of the next thing to fill, you know, in terms of priority, and that's what this has been scheduled to do. Those can be factors. I mean, if in your mind, you know, Commissioner, you feel that those are things that need to enter into compliance because they're part of the overall job responsibility, I think that helps illuminate the discussion. Certainly that should factor in, but if we start trying to solve every HR, you know, problem today relative to the CEO, I don't think we're getting.
I don't know how you do one without the other. So if she violates the district charter, which under Article 6 she's not to do, if she violates the bylaws of the district, yet complies and has an effective improvement of the compliance program, is she going to get a raise? I think not. I think violating the district charter and the bylaws, and you're right, one might be, you discussed termination, it's hard to separate these two. It's hard to say, if you break the law under the charter, you're okay on the effective improvement of the performance plan, or the organization as well. So you're still gonna get the 30%, whatever we end up on there, you're still gonna get that raise, even though you did not comply with Article 5, Article 6 of the contract.
Well, to the extent those items are part of compliance, then I think those could be part of the discussion. I think that's what I was saying. If those help illustrate what else could be part of compliance outside of just the CIA, then certainly, you know, those could be.
Does the CIA require us to abide by our bylaws?
In the book, I don't think so.
Does it require us to comply with our policies?
Yes.
So that's in Article 6.
Well, except compliance policies, right, or all
I think it
policies
just
of
says
the
North Broward
district.
Hospital District policies and
I don't
procedures.
remember.
So it doesn't say we have to comply with the charter, the state charter, which is our law. It doesn't say bylaws. So if we're trying to figure out how to squeeze this into 4.1, I don't understand that. I mean, I would think we want to resolve all of these and have one performance evaluation that does this.
I don't know that something like that, I mean, there's a contract, and the four corners of that contract include, certain termination provisions, whether it's for cause or not for cause, okay? If we may have an incredibly effective compliance program, but if you violate one element of the contract, that may be grounds for termination. We would choose, at that point in time, whether or not that violation, in our opinion, rose to the level of termination. If she's terminated, then there's no bonus anyway, no matter how effective the compliance program is. So I mean, I understand the point, but I'm not necessarily convinced that there isn't the remedy at the board level to address such a thing.
Can I ask something? And I just realized Bev walked out, maybe we should ask Bev what she thinks a effective compliance program is, where does she think we are today, and what does she think she can accomplish by January 31st, when her one-year anniversary of her contract is over. I'd be interested to know what are the things that she sees are things that can be improved from her perspective. I mean, we've given a lot of perspective on ours. I'd like to hear from Bev, where does she think needs to be improved? Is it communication? Is it cooperation? Is it contracting? Is it, her staff's communicating together? Is it input from the board? Is it relationships with the board communicate? I don't know. I'd like to hear from Bev.
Well, I think that's a good idea. Let's do this. Let's
take a break and do that.
Before we take the break, let me outline what I think, I have in my mind, and I think based on the discussion, a lot of us hopefully have, as the rough outline of the elements of the plan. Number one, well, Patricia, why don't I cover what I have, and then let's see if we're on the same page. One, obviously, as we've said repeatedly, is contracts, particularly focused contracts. And I think, well, that's a question as to whether we make the category solely focused or whether we make it contracts and focus as a subcategory. But criteria number one would be all focused contracts within compliance 360. Number two, would be completion of all requisite fields within Compliance 360 that are required to meet our needs under our compliance program. With obviously being that latter part being a little vague, and need some definition. Item number 2 would be annual timely submission of the report under the CIA with improvement reported under that annual certification. So the board would be timely filing the report and would be reporting improvement year over year in our compliance. Item number 3 would be positive feedback from the monitor relative to the district's compliance with the corporate integrity agreement. Item number 4 would be under the category of payments to vendors. Number 1 would be, or A would be, that no payment will be issued without the contract being within Compliance 360. Number 2 would be the payment would be consistent with the terms of the contract that's entered into Compliance 360. And 3, obviously no payment without the contract being in there, so those kind of overlap. But the contract would have to be in 360. The payment wouldn't be issued without the contract being in there. And 3rd, the payment would be consistent with the terms. So I kind of reverse the order there improperly. So does that make sense? 1, the contract's in 360. 2, the payment's not made without the contract being in there. And 3, that contracts would be
Yeah, but the payments are a policy. The payments are a policy.
Let me just cover these, and we'll circle back. We'll take a break and we can circle back. 4 would be that there's effective training and education of all personnel under the requirements of the Corporate Integrity Agreement. There are a number of elements under the CIA which require ongoing routine training and education.
Yep.
So that, to me, is an element, and perhaps that factors into a survey as to whether people feel they're getting the appropriate training and feel they have the resources they need to honor the obligations and perform their jobs in a compliant manner. And potentially number 6, which is what Commissioner Berry mentioned, compliance with Broward Health policies and procedures as a potential additional category. That to me is the landscape. I mean, do we have some general agreement that those are the topic areas we want to cover? So with that, why don't we take a break? I think we could all use one, and then we'll take a 10-minute break and then reconvene. I guess before we take that break, we should discuss what we're going to do about the second workshop, which was scheduled to start 46 minutes ago. Do we want to reschedule that workshop, or do we want to complete this, or just see where we are after we get completed?
I do think you have to let the public know if it's going to be much later than we are anticipating. This probably isn't going to be 15 more minutes, I would think. I think you have an obligation to let the public know if it's going to be canceled and rescheduled, and I think that should be a decision made now.
I tend to agree with that.
I would suggest we don't cancel it, that we at least get an overview and an explanation of what it means, so that we can all take it back with us to our offices and look to see if it's good. So the next time we come back to get it done, we're not in the explanation phase. We at least have some understanding, and we get past the introduction, and the staff can explain to us what everything means and how it's measured. So everybody got it, everybody sees it, but what it really means, let's at least get that part in. And so the public can see too, what are we looking at? And then by the next meeting, we'll be able to, I think, effectively run through it and get it done much quicker than if we just start all over again.
So you think a 15-minute presentation and overview of what has
Do you
been
think that'd be enough,
proposed?
Gino? Because Jim, you're doing it.
Yeah, I think that would be sufficient.
So why don't we, let me make the suggestion, why don't we reconvene, have that 15-minute overview of that plan, and then circle back to this item, so that item doesn't get squeezed out if this continues to run longer than we envision.
We're getting a shaking of
Right,
hands
because
over here.
it's 2 different meetings,
That's true, okay.
so you
All
really
right.
can't, yeah, so.
Can we just walk on the continued discussion of this issue on to the next meeting?
Or you could, since it was noticed, you could let people know that it's starting late, if you think it's a half hour at 2:30 or something, and make sure you end this one at 2:30, but the public has to know that.
I was thinking at 2:15 that we end this meeting at 2:15. That gives us plenty of time to hopefully get some meat on the bones here. And then have our next board special workshop convene at 1:15 with a 2:15 with a 15-minute time frame for that.
Why don't we end this meeting at 2:30, because we're gonna take a break. It gives us an hour, 2:30, come back at 2:45, from 2:45 to 3 o'clock, let Gino do this presentation on the metrics that they've been using, and then 3 o'clock we go on to the June meeting and then the July meeting. We've got a lot to cover in the July board meeting. We're gonna figure contracts and things that need to be approved. And that way we'll have about 45 minutes or so to finish this meeting and at least get what we want, and then we have 15 minutes set aside there, and that way everybody knows exactly what this is, and we stay on it.
Yeah, not that I'm wasting away. I don't know procedurally, my initial suggestion was that you adjourn this meeting and you open the next meeting, and we walk on and continue discussion of this issue onto that agenda. I just think to be fair to the public, that would be my suggestion, but I don't know that being fair to the public is the legal answer. I think it's the practical thing though, but that's,
There hasn't been a big change in the personnel in the audience, I've seen since this morning. I don't know if anyone's here specifically for the board metrics workshop. Perhaps we could ask them, is there anyone here specifically for the board metrics workshop, performance metrics?
Mr. Chair, I believe I'm the only public person here not employed one way or another by Broward Health, and I waive any problem with notice.
Thank you, Mr. Lewis.
No, actually, we're publicly and not paid too.
Yeah.
Just so you know. Okay?
Excuse me, except for the board.
Okay.
All right, thank you. Why don't we do this? Why don't we, we'll reconvene this meeting at 1:30 sharp. We'll run until 2:20. Then we'll do a 15-minute overview. We'll convene the next special board workshop at 2:20, with a 15 to 20-minute limit, because I do have to attend a meeting within that tight time frame. I'd at least like to check into another meeting with our medical chiefs within that. So that is the schedule. We will resume this meeting at 1:30 and go to 2:20.
Agreed.
Thank you. We stand adjourned.